Good evening, everyone. It gives me immense pleasure to welcome you all to day 2 of the Pranava National Seminar presentation. Yesterday was a day filled with insightful discussions, thought provoking presentations, and a shared commitment to promoting and advancing Ayurveda. Today, we continue this enriching journey with renewed enthusiasm and focus. I would like to take this opportunity to express my heartfelt gratitude to the dedicated panel members who have worked tirelessly behind this scene, putting in countless hours to ensure the success of this seminar. Your efforts, vision, and passion for Ayurveda have brought us all together on this meaningful platform. Without further delay, let us dive into the first presentation of the day, which promises to add yet another layer of knowledge to our collective understanding. Wishing you all a fruitful and engaging section ahead, dear participants. First, we go to the paper presentation. First, I would like to invite Dr. Shubhangi Shahu Sonavane for the paper presentation on the topic General Awareness of Aharyogi, Nutraceuticals.
Everyone. I am Dr. Shubhangi Shahu Sonavane, PG Scholar, Dermatology Department, LRP Ayurvedic Medical College, Islampur District, Sangla, Maharashtra. Right, Dr. Aniket Soshi. Today my topic is general awareness on Aharyogi, that is nutraceutical. Hello everyone. Introduction. History of nutraceuticals. Hippocrates, father of Western medicine, said, "Let food be the medicine." The modern nutraceuticals market began to develop in Japan during 1980s. Definition of nutraceuticals. Any substance that may belong to a plant, food, or any essential components of food which adds nutritional value, provides the health benefits, including the prevention of disease or a promotion of health. Objective. First, to study the concept of nutraceuticals. Second, to differentiate between pharmaceutical and nutraceuticals. Concept of nutraceuticals, that is Aharyogi in Ayurveda. Pharmaceutical is the drugs used in the treatment of a disease. Nutraceutical is nutrition that may prevent the disease. Nutrition required for health. Pharmaceuticals remedy for the sickness or injury. The combination of both nutrition and pharmaceuticals is nutraceuticals for preventive medical approach. Methodology. Types of nutraceuticals. There are three types of nutraceuticals. First, dietary supplement. Product taken by mouth that contains a dietary ingredient intended to supplement the dietary food. Example, vitamin, minerals, herbs. Second, functional food. The functional foods have been either enriched or fortified by process called nutrification. Example, health drinks, chocolates. Third, medicinal food, formulated to be consumed or administered internally under the supervision of physician. Classification of nutraceuticals. First, classification on basis of food source. Plants, animals, and microbial. Plants, example, ascorbic acid, lycopene, linoleic acid. Animals, example, choline, streptococcus. Microbial, example, yeast, lactobacillus. Second, on the basis of chemical nature. First, phenolics, tannins, flavonols, isoflavonols. Microbial, prebiotic, probiotic, minerals, calcium, potassium, zinc, etc. Carbohydrate, protein, folate, choline. These are the examples. Components used in nutraceuticals. Antioxidant. These are substances which regarding or prevent damage caused by oxidation. Example, soybean oil, corn oil. Second, probiotic. They are live microbial food ingredients which are beneficial to health. Example, lactobacillus. Third, prebiotic. They selectively promote the growth of colonal probiotic bacteria. Example, insulin, lactobacilli. Fourth, dietary fibers. Scope of nutraceuticals. To reduce the anti-nutritional factors of feed components. To activate immunity, growth promotion, promote the substantial aquaculture production. Nutrition, security to fishes, shellfishes, and quality nutritional security for human population. Increased feed consumption, induced maturation, stress mitigation, antimicrobial capability, no negative environmental impact, and hazardous problem. Nutraceuticals in Ayurveda. Although the concept of nutraceuticals is gaining more popularity in recently, its root can be traced to ancient Indian system of medicine Ayurveda. Medical benefits of food have been explored thousands of years ago. न च आहार समम किंचितम भेषजम उपलब्धे आहारो महा औषधम उच्यते काश्यप संहिता सूत्रस्थान chapter 4th. Ahar and Aushadha. In classics, food is considered to be Rasa Pradhan, whereas Aushad drug is Virya Pradhan. Primary metabolites such as carbohydrates are the major ingredient in food. In Aushadha, secondary metabolites such as alkaloids are seen in greater amounts. Commonly used nutraceuticals in Ayurveda. Chavanprash, Brahma Rasayan, Falagrita, Rasanukshirpak, Shatavari Grita. Ahar Here are some examples of herbs. Turmeric has antimicrobial activity. Garlic used in treatment of hyperlipidemia. Karela has hypoglycemic effect. Spirulina, immunostimulant activity. Flaxseed reduces PP in hypertension. Aloe vera, anti-inflammatory. Ginger, carminative. Green tea, antioxidant and reduces the risk of CVD, cardiovascular disease. Conclusion. When a food aids in the prevention or a treatment of a disease, it is called a nutraceutical. Diet rich in nutraceuticals along with regular exercise, stress reduction, and maintenance of healthy body weight will maximize the health and reduce the disease risk. Nowadays, nutraceuticals have received considerable interest due to potential nutritional safety and therapeutic effects. These are the reference list. Thank you so much.
Thank you, Doctor. Thank you for the wonderful presentation. Up next, we have an insightful presentation on Ayurvedic management of Amavata, a clinical case study, showcasing practical approaches and outcomes in treating this condition. I would like to invite Dr. Rutuja Bhausaheb Ahire for the paper presentation.
Good evening, everyone. Myself, Dr. Rutuja Bhausaheb, PG Scholar of Nasya Chikitsa from the College of Dr. D.Y. Patil College of Ayurveda Research Center, Pimpri, Pune. Today's topic for paper presentation is an Ayurvedic management of Amavata, a clinical case study guided by the Dr. Gunwant Yevla. Sir, introduction of Amavata. Amavata is a painful multiple joint involvement systemic disease. It is a disorder in which pathogenic constituents are mainly Am and Vata. Madhava emphasizes that it is a systemic disorder where digestive and metabolic mechanisms are involved. The disease Amavata can be correlated with a rheumatoid arthritis owing to similarity of clinical presentation. Introduction of rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease causing a chronic symmetrical polyarthritis with systemic involvement. The management in modern science includes our use of NSAIDs, glucocorticoids, DMRs, immunosuppression therapies, long-term use of which leads to many side effects. The case study is that a 46-year female patient visited to the Kai Chikitsa OPD with complaints of multiple joint pain, on and off swelling over the ankle and wrist, morning stiffness, on and off loss of appetite, constipation, able to walk with the help of walker, difficulty in performing the daily routine activities. The past medical and surgical history is nothing specific. Appetite is irregular and bowel is constipated. The classical etiology is Vriddhi Ahar. Viruddha Ahar plays an important role in causing ambar. In my patient, intake of heavy food and spicy food is made. The Ashtabit Pariksha is pulse is Vata dominant, urine is normal, motion is constipated, tongue is coated. Weight is approximately 35 kg. In systemic examination, all Walton signs were normal. On examination, severe bony tenderness, bilateral pitting edema over the legs, restricted movements of affected joints due to pain. Walking time with walker for 20 feet was 40 seconds. In laboratory investigation, the RA factor is positive, CRP is negative, HB is 9.4, remaining is normal. The diagnosis is Amavata. The Samprapti Ghatak of Amavata are doshas are three dosha, mainly Vata. Specifically, Saman Vyan Apan Vata, Kledak, Slekshmak, Bodak Kapha, and Pachak Pitta. Srotodrushti is Sangha and Vimarga Gamana. The affected srotas are Annavaha, Rasavaha, Ashtabit, Majjavaha, Udakvaha, Purishvaha, and Mutravaha. The Chikitsa Sutra of Amavata is Langhanam Svedanam Tikta Deepanani Katunisha Virechana Sneha Panabastascha Ama Marute Ruksha Svedo Vidatato Valuka Potalis Tata Upanahascha Kartavyasta Api Sneha Vivarjita. The principles of management as Langhan, Deepan Pachan by the Tikta Katurasa, Ruksha Svedam, Virechan Basti Chikitsa, Vata Kapha Shaman Chikitsa. The line of treatment is after considering the etiopathogenesis, that is Samprapti of Amavata, the following treatment is followed. That is, first, the Langhan is the first line of management explained by the Amavata, which helps to pacify the Amba. So, for the first 5 days, light food is advised for increasing the digestive fire. Later on, patient was admitted in the female ward for the duration of 21 days. Oral medication should be Agnitundi Vati, 1 BD, Sihanath Gugur, 2 BD, Yograj Gugur, 2 BD, Anulomak Vati, 3 HS, and the Kada of Rasna, Devdaru, Guduchi, Shunthi, Erendamul, each 3 gram, 40 ml Kada on empty stomach for 21 days. The Shodhan Karma includes Panchakarma, where Valuka Potali Swed, Sarvanga Peti Swed for 21 days, and Vaitaran Basti for 16 days. Also, bloodletting therapy was also done, and physiotherapy also. The observation of the study is that pain in joint and wrist shoulder joints before the treatment they were present with a 7+ fast scale. After treatment, it's absent. Morning stiffness is present with present, and after treatment it's absent. Swelling over the knee, wrist, and shoulder joint is 2+. After the treatment, it's absent. Difficulty pain while walking in the knee joint is 6+ VAS, while after treatment it's 2+ VAS scale. Local examination includes tenderness is grade 2, after treatment is grade 1. Swelling was present and joint crepitus was not present. So after the treatment, swelling will be mild present and remaining is a not present. So the discussion of the study is that in present study, patient got relief from the pain, stiffness, constipation, and able to perform the daily routine activities without the support of walker. The main mode of the treatment is to relieve the biotoxin, ama dosha, which in turn relieves the stiffness and pain. Digestive fire was increased and constipation was relieved. Treatment modality acts as a Vata Kapha pacifier, which in turn acts as a barrier in the etiopathogenesis of Amavata. The conclusion is that Amavata is a chronic joint inflammatory condition with a multisystem involvement which requires early recognition and effective long-term treatment. Though Ayurvedic medicines, the patient quality of life can be improved with the less side effects. Present study is the case report which had shown marked result in the symptoms and patient had reduction in recurrence of the symptoms. As it is a case study, the oral medication and Panchakarma therapy can be tried over the large population for seeing the marked result. Thank you.
Thank you, Dr. Rutuja. Next, we go to the poster presentation. I would like to invite Dr. Rutuja Bhausaheb Ahire for the poster presentation on the topic Nasya Chikitsa in Pakshaghat, a novel approach to rehabilitation, offering innovative insights into this Ayurvedic treatment. Next, we go to the poster presentation.
Good evening, everyone. Myself, Dr. Rutuja Ahire, PG scholar from Department of Kai Chikitsa from Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. So, the today's topic for poster presentation is Nasya Chikitsa in Pakshaghat, a novel approach to the rehabilitation, under the guidance of Dr. Gunwant Yevla sir. So, the introduction of Pakshaghat is that Paksha means a side and Aghat means a destruction. Impairment of कर्मेंद्रियस, ज्ञानेंद्रियस, and mana is seen. Nasa hi shirisodwaram. So, the aim is that to assess the efficacy of Nasya Chikitsa in improving motor functions and reducing spasticity in a patient with a Pakshaghat. The shlok explained by the Acharya Bhavprakash is that Pakshagata Nasya Kuryata Panchakarmana Tenahi Vata Pitta Kapha Dosha Shamanam Bhaveta. So, the benefits of Nasya in Pakshagata is that it stimulates brain and nervous system. It enhances motor function and muscle strength. It reduces spasticity and stiffness. It promotes relaxation and reduces stress. It supports overall health and well-being. And it also helps to balance the three dosha. Specifically, Nasya oils used are Anu Taila, Panchaguna Taila, Bala Tail, and Panchendriya Vardhana Taila. According to the modern aspect, the action of Nasya is that it direct stimulation of nasal mucosa, which is recently inverted with a nerve ending that are connected to the brain. According to Ayurvedic, beneficial to the strength, the indriyas by reducing the indriyas drushti. The conclusion is that Nasya Chikitsa has shown promising result in improving brain function, reducing spasticity, and reducing symptoms of anxiety and depression in the patient with a Pakshaghatha.
Thank you, Dr. Rutuja. Thank you for the wonderful paper and poster presentation. Next, we have Dr. Sai Prasad Bharat Sable presenting on Neeli, the indigo plant, exploring its Ayurvedic significance and therapeutic applications. I would like to invite Dr. Sai Prasad Bharat Sable.
Morning, sir. And myself, Dr. Sai Prasad Sable, second year Vigyan scholar from Yeshwant Ayurvedic Medical College, Kodoli, Kolhapur. My topic is Introduction of Nili, the indigo plant. First slide. Introduction. The Nili Varno Asta iti means the term Nili means that which has blue color. Second, Nilam Pada Asta is also mean that from which blue color dye is produced. In the water, Acharya Shivdatta has explained the morphology of Nili. It's called Nilika, Nilapatra, Sacha, Punkha, Dala, Sara, Us, Sembi, Kalika, Cha, Ranga, Patri, Cha, Jajane. Systemic classification, botanical name Indigofera tinctoria, family Fabaceae or Leguminaceae, genus Indigofera, species Indigofera tinctoria. The plant, the second slide, the plant review. First, plant is Lily, a Latin name Indigofera tinctoria Lily, family Fabaceae, Rasa Tikta, Vipakrutu, Vidaushna, Guna, Laguruksha, Gana, Videshanagan, according to Charak Samhita. Next slide. This is a three picture of Nili. First, in first picture, the leaves of Nili has been explained. In second picture, the morphology of Nili is explained, and in third picture, flower and leaf of Nili is explained. Next slide. The vernacular name in Hindi, Nili called Nil. In Kannada is Nili. In Gujarati is Gale. In Tamil is Nilam or Avere. In Bengali is Nil. In English is called Indian. In Marathi is Nili. In Telugu is Averi or Nila Chetra. In Malayalam is called Nili Amare. Next slide. Classical category according to Charak Savita, according to Susrut and Dhanvantari Nigantu, Madanfar Nigantu, Kaidev Nigantu are explained the category of Nili which has best. First, according to Charak Savita, has mentioned as herb in Virichan for Mahakashay as it is helpful in purgatory herb. Second, Acharya should also mention herb in Adho herb. Third, Dhanvantari Nigantu is cited under the Gurucharya Varga and is called Kala, Grame, Dhola, Vishorni, Vitrani, Sri Falaka. Fourth, the Madanfal Nigantu is kept under Abhayati Varga and is called Ramya, Sri Fala, Brahavaini, Rajani, Kalika, Mela, Tuni, Ushika, and Vishodni. 5. Kaikadeva Nigantu is cited or placed under Aushadi Varga and is called as Mil, Kali, Dola, Vishodni, Gramya, Tucha, Tutha, Nilpushpi, Sarata, and Brahvani. 6. Raj Nigantu is cited under Satvedi Varga and is called Tucha Rajni, Nili, Anil Pushpi, Kali, Samya, Sodhi, Srifala, Gramya, etc. In 7, Bhavaprakash Nigantu is described under Puruchaji Varga and called Tunni, Kala, Dola, Nilika, Rajni, Srifala, etc. Annotation in Dhanvantari Nigantu, Madanfar Nigantu, and Kaikari Nigantu has given 10 symphonium each. Acharya Narhari Pandit has given 29 synonyms to describe plant. Synonym Nilika given by Nigantu mentioned above. The synonym Tutti highlighted is blue dye. Next slide. Habitat. This is the shrub that is 1 to 2 meters tall, is annual, biennial, and perennial. It is growth rate depend on the weather, climate, and temperature. It has light green pinnate leaves, which consider of pink no violet color flower. This is a found temperature regional of Asia, Africa, and worldwide in the various countries. Flowering and fruiting times. Flowering and flower are usually bloom from September to November, fruit from December onward. Important synonym describe the morphology. Next slide. Factor related to morphological synonym. Habitat, Gramina. Leaf, Nilpatiya Tutta. Pendulum, Pendusil, Ventica. Flower and fruit card, Gandha, Pushpa Phale, fruit Sriphale. Next slide. Effect on dosha. This herb helps to balance the vata dose because of its Ushna Guna and help to balance the kapha dose by Lagu Ruksha Tikta Ushna Guna. This is worldwide used for promoting hair growth as a coloring agent. Next slide. A shloka. Nilena tu nile tu nilini tulika kala dolasa nilika rajani srifala tutya gramina madhuparne Tolikat कालकेशी नीलपुष्पीच स्मूता नीलिनी रेचने तिक्ता केशा मोह भ्रमपाहा उष्ण उद्यत पिला वातरक्त कपानीलान आमवात आमवात मुद्दवातम वदस्ස विश्व means reference from Prakash Nigantu Guruchaji Varga interpretation of lok नीले नीलिनी पुण्य काला धोला नीलिका रजनी श्रीफला तुच्छ ग्रामीणा मधु पर्णिका Lita, Kalish, Nilpushpa are of a synonym of the herb. The herb is considered of bitter in taste, help in Prabhuta is good for our hair, is of hot potency, reduce the vertigo, ac- acidic acidic condition, spleen disorder, gout, Waters condition, osteoarthritis, bloating, and alcoholism, and any type of poisoning cause. Next slide, श्लोक number 2. नीली तिक्त रसे पाके सरोक्ष्ण ब्रह्म मोहपूत कफ नीलाहार केश इल्लद विषपः वात रक्त मुदा वात मम वात गद हरत. Reference from Sutta Sahita, Suttastam are 28 by 8. Interpretation of stroke means this herb is tikta in taste, probiotics, hot, potential, and vertigo. It is very effective in coughs and water purification and good for hair luster, skin detoxification, ascites, and poisoning cases. Gout, bloating, and arthritis can be managed with the help of this herb. Next slide. Third श्लोक नीले तिक्त रसे चोष्णा कटी वात कपपहा केशा विशोदर हंति वात सुख कृमिनाशने. Reference from Dhanvantari Nigantu means श्लोक meaning this herb is bitter, hot, and potential cures lumbago, poisoning, abdominal disease, gout, or any rheumatic infection, specific kapha dosha, and mainly work on improving the health texture. Next slide. Fourth श्लोक नीलिनेतु कटु उष्ण केश कास कपनोत मरुषति उदर व्याधि कुल्म जंतु ज्वर पहा. Reference from Rajanigantu. Meaning of slok is herb is bitter, pungent, hot in potency, good for health, reduce cough and vata. Dosha is also help in poisoning cases, is antimicrobial and clampherious disorder. Next slide. Practical uses of Nili. Indigofera tincture. Nili is also known as Indigofera tinctura. Is highly valued herbal in Ayurvedic medicinal known for diverse therapeutic property. Here are practical uses and benefit of Nili. Preventing kapha and water disorder. Nili is effective in balancing kapha and water dosha, making it useful in treating disorder associated with the dosha. This include conditions like respiratory issue, joint problem, and skin disorder. First, lechan, scraping. Neeli can be used powder form to scrap cataract. This traditional method involving applying the powder to affected area to help remove a cataract. Second, analgesic property. Neeli act as natural pain reliever, which can apply as a paste to area affected by arthritis and hemorrhoid to provide analgesic effect. Third, healing property. Nearly promoted the healing of wound, ulcer due to anti-inflammatory and antimicrobial property. Is participate really effectively when applied as a paste or non-healing wounds or ulcer for quick healing. Fourth, poisoning removal. Nearly benefit is reducing the effect of poisoning from snake or dog bites. Applying nearly paste to wound can help them migrate the toxic effect. Fifth, a skin disorder. Nearly arthritis, various skin disorder due to the anti-inflammatory and antimicrobial property. It used to formulation to treat conditions like cirrhosis, autoinflammatory skin disease, sick anti-inflammatory elementous property. Nearly has property that help to explaining parasite worm from the body, making useful and treating worm infection, infection. Second, heart tonic and liver protective. Nearly act as heart tonic and has liver protective property. Is support to cardiovascular health and helping detoxification of liver improve its function. Okay. Diuretic and anti-inflammatory. Nearly has diuretic property, promoting the removal of excess fluid from the body. It also possesses potential anti-inflammatory property, making it effective in reducing inflammatory in various conditions. 9. Maintaining body temperature. Nearly help in maintaining normal body temperature, which is beneficial in facial various conditions. It is often given with the black pepper powder to enhance the effectiveness in reducing fever. Then, respiratory disorder nearly is used in treating cough, lung infection, and other respiratory disorder by eliminating cough dosha. It helps in cleaning mucus and improve respiratory function. 11. Hair growth and texture. Nearly used in Ayurvedic medicine to promote hair growth, improve hair texture, and prevent premature graying. It can be used in powder form to achieve this benefit. Next slide. This formulation. Nearly Brungyadi Tela, Nearly Andi Gruta, Nearly Adi Churna, Nearly Kadi Churna. Next slide. Market product. The Nearly plant, also known as indigo ferret tinctura, is a versatile plant which is wide range of products available in the market. Here are some of the key products derived from the lily plant. First is indigo powder, hair care. Indigo powder is widely used for natural hair dyeing. It impart a deep or black color, blue or black color to hair and is often used to combination with henna to achieve various shade is known as promoting hair, preventing premature graying, and treating dandruff. Medicinal use. Indigo powder is used in Ayurveda medicine to treat liver, spleen disorder, rheumatic arthritis, gout, and fever. It is also used for antifungal property and ability to absorb UV light. Second, indigo leaves. Dyeing. The leaves of lily plant are harvested to extract indigo dye. This dye used for coloring textile and has been historically significant in trade to network across the India subcontinent, where West Asia and hair care. Indigo leaves can be soaked in coconut oil and applied to scalp, promote hair growth and maintain hair health. Third, Nilbhungadi oil. The oil is blend of various hair care ingredients including amla, bringraj and different type of milk like coconut milk, goat milk and cow milk is used for nourishing and straightening of hair. Fourth, Nilichurna, indigo powder available in various quantity. The powder is used for coloric fastness and ability to impact a natural black color to hair. It is also used in traditional medicine for its therapeutic property. 5. Indigo seed. These seeds are used for plantation purpose. They are available for purpose and can be used to grow nearly plant for both commercial and personal uses. 6. Indigo dye plant. These plants are sought for their dyeing property and are suitable for use in textile dyeing and prevention of pigment like for fine. And thank you.
Thank you, Dr. Sai Prasad. Thank you for the wonderful presentation. Next, we go to the another paper presentation. I would like to invite Dr. Manju Yadav for the paper presentation related to the Gridrasi, a case report. We go to the paper presentation.
Good evening, everyone. My name is Dr. Manju Yadav, PG scholar from the Department of Kaya Chikitsa. Topic of today's paper presentation is Clinical Management of Gridrasi through Ayurveda, a case report. Gridrasi is the most common problem in middle and old age people, which is characterized by its distinct pain emerging from buttocks and going towards the heel of either sides. According to modern science, it can be well correlated with sciatica. In this disease, the gait of the patient resembles to that of the bird grid. According to Acharya Charak, Gridasi is characterized by Stamba, Ruk, Greh, Tod, and Spandan. Coming to the case presentation, a 50-year-old female patient came to our OPD with complaints of pain and stiffness in lower back region and left leg, difficulty while walking and bending, heaviness in bilateral lower limbs since past 6 months. Past history, no known case of HTN or DM or any other major illness were noted. Nidan, Ati Chankraman, Veg Dharan, Nidra Nash, long hours of sitting and standing. Ashtavid Pariksha was done on the patient where Jiva was found to be Sama. Here are the gradations and durations of the complaint. Pain in the lower back region radiating to left leg was 7 plus on the VAS score. Stiffness in lower back region and left leg was 3 plus. Tingling sensation in the left leg was 2 plus. Heaviness in both legs was 3 plus. Difficulty and pain while walking and bending forward was 6 plus on the VAS score. Clinical findings. Inspection, limping gait and discomfort in walking while and sitting for long durations, palpitations, tenderness was +2 at L4 and L5 region, muscle tone was good, muscle power was found to be 5 by 5 on both left and right extremities. SLR test on the right leg was positive at 60° and on left leg was found to be at positive at 40°. Shaman Chikitsa, Maharasnadi Kashay, 20 ml BD after food. Parijata Ghanvati, 250 mg 2 BD after food. Aaron tail 15 ml HS before sleep. with lukewarm water for the duration of 21 days. Ekang V Ras 125 mg 2 BD after food with lukewarm water for 14 days. Coming to the Shodhan Chikitsa, Sthanik Snehan with Bala Tel, Sthanik Nadi Swed with Dashmul Adi Kwat, Kati Basti with Bala Tel, Anuvasan Vasti with Dashmul Tel, and Niru Vasti with Erin Muladi Kwat on alternate days was given for 21 days. Agnikarm at Kati Pradeshi on 5th and 15th day. Sira with 4 angul above and below Janusandhi on 7th and 15th day. Here are the observations on day 1, 14, and 21st. Pain in the lower back region, stiffness in lower back region and left leg, tingling sensation, and heaviness in both legs was found to be 0 on the 21st day. Whereas difficulty and pain while walking and bending forward was +6 on the VAS score on day 1 and +1 on VAS score on 21st day. Observation: Parijata Ghanvati helps pacify Vata dosh and reduces pain and stiffness in sciatic nerve pathway. Erentil balances Vata dosha and reduces nerve compression and provides Snehan. Maharasnadi Kashaya is effective in relieving joint pain and stiffness. Ekang Veer Ras strengthen nerves and muscles. Probable mechanism of action: Snehan reduces vitiation of Vata, thus addressing the share in dhatus and improves circulation. Sweden clears obstructions of channels and dilates blood vessels and improves circulation. Basti helps in pacifying the Vata. Kati Basti helps pacify the Vata Dushti and Kapha Dushti. Agni Karma works on Vata by its Ushna and Tikshna Gud and on Kapha Dosh by Laghu Sukshma Tikshna and Ushma Gud. Siraved removes obstructions of blood vessels and establishes normal circulation. Discussion. Pathogenesis of this case was Dhatu Shaijanya. It is concluded that combination of Ayurvedic formulation along with Panchkarma therapies, Snehan, Sweden, Basti, Agnikarma, Siravedkarma synergistically proved to be effective in the management of Rudrasi. Moreover, the modern treatment of sciatica is not considered very satisfactory and includes use of analgesics and some surgical procedures, which is often associated with many adverse effects. So, with Ayurvedic treatment, we can successfully avoid surgical intervention. Thank you.
Thank you, Dr. Manju Yadav. Thank you for the wonderful presentation. Next, we go to the paper presentation. Sorry, next we go to the poster presentation by Dr. Manju Yadav. The topic of poster presentation is Ayurvedic approach to Sandhigata Vata.
Good evening, everyone. Topic of today's poster presentation is Ayurvedic approach to Sandhigata Vata. Sandhivat, known as osteoarthritis in modern medicine, is a degenerative joint disorder characterized by the deterioration of joint cartilage and underlying bone. It is caused by vitiation of Vata dosha and depletion of Shlishma kapha, leading to joint degeneration and pain. The treatment focuses on managing Ama and Niram stages of the disease. In Amavastha, the presence of arm obstructs the body channels, leading to symptoms like swelling, stiffness, and severe pain. The treatment includes Amapachan, Trikatu Churna, Chitrakadi Vati, Shankhavati can be given for 3 to 4 days to enhance digestion, metabolism, aiding in the elimination of ama. For Langhan, light, warm, and easily digestible food like Yavagu should be given. Heavy, cold, and oily foods should be avoided. For Vaj Shaman, Snehan with Sandhav Lavan oil should be given and Ruksha Swedan to reduce stiffness. In Niram Avastha, once arm is eliminated, the focus shifts to pacifying the aggravated Vata dosh and rejuvenating the joints. The treatment includes Snehan, both internal and external application of medicated oils to lubricate joint and reduce dryness. Internally, Erin tel or Sheer Bala tel can be used, and for the purpose of external use, massage with Mahanarayan tel or Dashmul tel should be used. Sweden, localized or full body fermentation using medicated decoctions like the Shamula Quath to relieve stiffness and improve mobility. Basti is considered the most effective treatment for Vata disorders. Anvasan Vasti with Bala Tel or Mahanarayan Tel for nourishment, and Sheer Vasti with like Ashwagandha Sheer Vasti for chronic Vata imbalances. Rasayan like Ashwagandha, Shatavari, and Bala are used to strengthen joint tissues and prevent further degeneration. Formulations like Panchatikta Grit Gogul, Yogaraj Gogul, Mahayogaraj Gogul, Mahavat Vidvans Ras are used for pain relief and inflammation. Coming to the discussion, it's essential to assess the patient's condition accurately to determine the presence of arm and tailor the treatment accordingly. Sandivat is a degenerative joint disease arising primarily from Vata dosha. The condition often results from Dhatu share, specifically in Asthi and Sandhi. The condition manifests as pain, stiffness, and reduced mobility affects individual. Ayurvedic treatment principles for Sandivat emphasize Vata Shaman, Dhatu Poshan, Shodhan Chikitsa, Shaman Chikitsa, internal administration of medication like Maharasna Dikwat, Lakshati Guggul, oils like Bala Tel helps in symptoms management and tissue repair. Pathya Apathya. Lifestyle and dietary modifications are important, with emphasis on avoiding cold, dry, and rough foods, and including nourishing foods like Godum, Raktashali, Draksha, and Badar, etc. Thank you.
Thank you, Dr. Manju Yadav, for the well-explained paper and poster presentation. Dear participants, we know that Guggulu, a revered Ayurvedic resin, undergoes various Shodhana methods to enhance its therapeutic properties and remove impurities. These methods are pivotal in ensuring its efficacy in treating diverse ailments. Next, we go to the presentation related to this. I'd like to invite Dr. Anagha Ajetrao for the paper presentation on the topic different methods of Shodhana of Guggulu.
Good evening everyone, this is Dr. Anagha Ajetrao presenting different methods of Shodhan of Guggul, a review. In Indian pharmacopoeia, we find Guggul Kalpana mentioned specifically. We find 5 varieties of Guggul in which we use Mahishka and Kana Guggul. As we all know, Guggul is a gum resin obtained from Comnifera vegetae. It includes all kind of physical as well as chemical impurities which needs purification, making Shodhana of Guggul a prominent step in any Guggul preparation. The gummy resin of Guggulu has two fractions. One is insoluble gum fraction, which is toxic, and another is soluble one, which has hypolipidemic and anti-inflammatory properties. The hypolipidemic portion is fine neutral in nature, while the anti-inflammatory portion is mostly acidic in nature. To separate the insoluble gum, which is toxic in nature, we need to do Shodhan of Guggulu. Then AFI mentions two methods. In method 1, physical impurities of Guggulu are removed and then broken into small pieces. Guggulu is bundled in a cloth and Svedana is done in different medias until soft. Then soft Guggulu is spread on ghee smeared wooden board. Again, foreign impurities which can be removed are removed. Then it is fried in ghee until soft and grounded in a stone mortar. Method 2 includes the same bundles is being suspended in dola yantra in boiling media until Guggulu is dissolved in the media and the remains of cloth are discarded. The dissolved Guggulu fluid is then filtered and boiled till soft mass is formed. Then it is dried in sunlight. Then dried mass is grounded in stone mortar with small quantities of ghee for waxy nature. AFI, Rasentra Sarasangraha, Ayurved Sarasangraha, Rasa Jalanidhi, Rasa Tarangini and Sharanda Tika have mentioned different medias for Shodhana of Guggulu as shown. Gana Nigraha Prayog has mentioned specific medias which can be used in specific diseases in kalpas as shown. Even Vaishyaja Ratnavali and Brihat Nighantu Ratnakar also few examples can be seen. Like in Abhayadi Guggulu, Abhaya and other relevant drug quack is used as media in Snayu and Mastikshka Rogas. Brihat Nighantu Ratnakar has shown Nimbaptwak and Patolvasa Trifala Quat in Nimbadi Guggulu in Shirorog. Guggulu has Rasa, Tiktakatu, Virya Ushna and Vipakatu as being a Ushna Virya Dravya. It is mostly used as Medohar. Other major chemical constituents are as shown. Guggulu extract include compounds known for their hypolipidemic properties. The Z and E isomer of the guggulusterone and it's related to guggulusterols. Guggulu is used as a binding agent and also as a main ingredient in various formulations. So Shodhana of Guggulu again shows as being a prominent step in preparation of any Guggulu Kalpana. One research I came across while going through the information was where they worked on antispasmodic activity of Shodhit Guggulu, different Shodhit Guggulu using different Shodhan processes. The three Shodhan medias were used: Gulvel, Trifala and Dashmul. Spasm inhibition was seen in different inducer like acetylcholine induced spasmodic activity or barium chloride induced spasmodic activity or histamine induced spasmodic activity. Spasm inhibition was mostly seen in these type. Another research worked on 7 different media being used for Shodhana of Guggulu, which were Gomutra, Godugdha, Trifalakvat, Vasaswaras, Swasakvat, Nirgundi Swaras with Haridra Churna and water, where physiochemical characterization of Shodhit Guggulu was done by determining the hash value. Different ash values were determined after studies, which will help in understanding the detailed physiochemical parameters of the Shodhan Guggulu. As we discussed earlier, Guggulu is a Ushnavirya and Katovipak. It is mostly used as a Medohar. Along with Medohar karma, it is a Kushtagna, Vata Kapahara, and other many karmas. Research also shows anti-lipidemic, hypoglycemic activities, anti-arthritic activities, anti-inflammatory activity, analgesic activities also seen of Guggulu. As discussed above, Guggulu is used in wide variety of diseases, making it a necessity to understand Guggulu Shodhana process with different medias that can be used during the process to increase the efficacy of the drug. The gummy resin of Guggulu has two fractions. One is insoluble gum fraction, which is toxic, and another soluble one, which has shown hypolipidemic and anti-inflammatory properties. Mostly the hypolipidemic portion is neutral, while the anti-inflammatory portion is acidic. This makes Shodhana of Guggulu a prominent step, making it a necessity to understand the process of Shodhana of Guggulu and its efficacy after using different medias for different diseases, which I have already mentioned. Following are the references which I have used. Special mention for Google Scholar, PubMed, ResearchGate. Thank you.
Thank you, Dr. Anagha. Next, I would like to invite Dr. S. Priyadarshini for the paper presentation on the topic Utility of Trayobastambha in Infertility.
Good morning, everyone. My name is Dr. S. Priyadarshini. My unique ID is 172. My title is Utility of Trayopastambha in Infertility, an Ayurvedic approach to reproductive health. Ayurveda, the ancient science of life, place significant emphasis on both physical and mental well-being through a preventive and curative approach. It defines health as a state where there is a harmonious balance in the function of three doshas, dosha, dhatu, mala, as well as agni, alongside of pleasant state of atma, indriya, and mana. Ayurveda describes three doshas, Vata, Pitta, Kapha, as the three main pillars governing the bodily functions. Similarly, Ahara, Nidra, and Brahmacharya are regarded as the three sub-pillars that support the main pillars. When utilized in a proper and planned manner, these three pillars facilitate an individual with the benefit of life endowed with strength, complexion, healthy progeny, and full lifespan. Health encompasses not only physical, mental well-being, but also the ability to produce healthy offspring. Infertility has increased tremendously in the past decades. Infertility is a disease of reproductive system defined by the failure to achieve an clinical pregnancy after 12 months or more, of regular unprotected sexual intercourse. This is according to WHO. Main disorders involved in affecting the fertility of an individual includes pathological spermatogenesis, ovulation issues or anovulation, tubal pathologies, PIDs, pelvic inflammatory disease, endometriosis, cervical factors, idiopathic reasons, usually referred as an unexplained infertility. According to Ayurveda, conception takes place due to the Ritu, Kshetra, Ambu, and Bija. For both men and women, reproductive health depends on the health of Shukradhatu. Shukradhatu itself is created as a part of long chain of metabolic transformations starting from Ahara Rasa, its transformation to Rasadhatu, and ultimately to Shukradhatu, the reproductive tissue. Healthy Shukra depends on the factors such as Ahara, Nidra, Brahmacharya. Contemporary medicine treatment focuses on correcting the dysfunctions diagnosed with several diagnostic tests. Moreover, the complication arising due to the infertility management include hormonal therapy, ovulation induction of invasive diagnostic techniques are huge. In case of unexplained infertility, artificial reproductive techniques are the only treatment option available. Their success rates are less and expensive too. Ayurveda, on the other hand, explain the concept of Traya Upastamba when followed by an individual can prevent fertility issues and treat unexplained infertility. These are the recent research works done on the concept of Ahara, that is diet, Nidra, Brahmacharya, that is sexual conduct. Infertility became an alarming issue since past decade. This is mainly due to the combination of nutritional, sleep, psychological, social, and environmental factors. The Nidana for Vata Vyadhi, the Nidana for Vandyatva, that is infertility, includes eating spicy, salt, and hot food. This increases Pitta and destroys Shukra. Ahara is important to regulate ovulation, improve sperm quality, and enhance fertilization. Acharya Charaka has mentioned Vajikarana Adhyaya about 12 Ahara Kalpana, beneficial for improving the fertility. Improper sleeping habits, Nidra, that is causes Nidra Nasha, is linked to dhatu imbalance, mental exhaustion, and systemic disturbance. Improper sleeping habits can lead to vata prakopa and cause shukrakshaya. Acharya Sushruta has mentioned the 3 types of sleep and about its importance of proper sleep as it promotes happiness, nourishment, strength, virility, knowledge, and longevity. Indulging in sexual activities that leads to shukrakshaya, loss of semen. It may also cause clybia, impotency. Controlling sexual urge for long duration that results in virya obstruction to semen, and leads to decreased libido. Ayurveda addresses the internal balance and external influences contributing to the problem by building the ojas, improving the overall health of individual, stimulating the hypothalamus and pituitary gland, thereby directly inducing the production of healthy sperms and eggs. Ayurveda focus on the rebalancing individual rather than just treating. The purpose of this study is to make aware of the people that Trayopastamba and infertility are interlinked, and infertility can be prevented by following Trayopastamba, and for some extent they can be cured also. Thank you.
Thank you, Dr. Priyadarshini. We know that Shalyatantra, the surgical branch of Ayurveda, plays a vital role in managing specific diseases with its traditional and effective techniques. Here to present on the topic, Dr. Vaibhav Rajendra Dongre, with his talk on role of Shalyatantra in the management of specific diseases in Ayurveda. I would like to invite Dr. Vaibhav Rajendra Dongre for the presentation.
Good morning, everyone. Myself, Dr. Raj.
I think it has some technical problem.
Good morning, everyone. Myself, Dr. Vaibhav Rajendra Dongre. I am PG student from Shalyatantra Department of ADM Shastra Sangli. My topic name is Role of Shalyatantra towards the management of specific disease in Ayurveda. Introduction. Many would be shocked to know the plain truth. It was Ayurveda of an ancient India that pioneered the modern concept of surgery. Well, Shalyatantra is a vital branch of Ayurveda, the literal meaning of which is removal of irritating factor from the body. The Ayurveda created Shalyatantra as a specific branch of surgical purpose. Shalyatantra presented surgical and parasurgical intervention for curing disease and restoring optimal health status. The branch helps to cure disease like cyst, hemorrhoid, abscess, urinary retention, wound, urinary stones, anorectal problems, and fractures. The major therapeutic approaches of Shalyatantra, Shastrakarma, Gudrok Chikitsa, Vrana Chikitsa, Anushastra, fracture rehabilitation. The Guggulu Chikitsa has a depicted in figure used to cure anorectal disorders such as fissure, piles, abscess, and hemorrhoid. The Vrana Chikitsa employed the management of wound, chronic ulcer, and guts, etc. The fracture rehabilitation technique used to relocate fracture bone and joints. The branch also helped to manage the post-operative complication and provide complete relief from the minor and major surgical emergencies. Shalyatantra Chikitsa for specific disease. Shalya Chikitsa use many diseases, especially anorectal problems such as hemorrhoid, fistula in ano, piles. Shalya Chikitsa helps relieve symptoms of painful defecation, bleeding, per-rectal discomfort in sitting, constipation, and burning sensation. Role in Arsha. Arsha can be managed effectively with the help of Kshar Karma and Shastra Karma. The Shastra Karma and banding techniques helps the early healing of Arsha and reduce the recurrent chances. Shalya Chikitsa when used to with suturing technique in Arsha, then it helps to control discharge, reduce burning sensation, cure itching, and suppress pain. Role of fishery nano. The Shalya Chikitsa facilitated relaxation of sphincter during the treatment of fishery nano and boost of healing by enhancing regeneration process. Avgha Swed of Triphalapat, sometimes advocated as accompanying treatment modality in case of fishery nano along with surgical intervention. The approach helps to cure inflammation and reduce sensation of pain. Role in Parikartika. Bhedan, Chedan, along with Ksharana, can be used effectively for the management of Parikartika. The Shodhan, Ropan, Stambhan, etc. properties provide therapeutic benefits in Parikartika. The Ksharan action of Ayurveda procedure helps to excise fibrotic tissue and facilitates removal of unhealthy debris due to their Shodhan action. Role in Bhagna. The concept of immobilization and reduction play vital role in the management of Bhagna. However, Ayurveda procedure of banding helps to relocate the position of fractured bone. Traction, opposition, and stabilization followed by banding advocated for rehabilitation of Bhagna. Sushruta mentioned cross banding over the dislocation of shoulder joint. Role in Vrana. The Shalya Chikitsa play a vital role in the management of Vrana. The Drushta Vrana first converted into Shuddha Vrana and helps surgical and purification measure along with the uses of herbal medicine. Ayurveda mentioned Avsechan, Vimbalapan, Patanakriya, Ropan, आणि Vaikurtapraham, etc. as therapeutic approaches for the management of Vrana. Thank you.
Thank you, Dr. Sayed. Thank you for the well explained presentation. Next, we go to the another presentation. We know that gangrene is a serious condition caused by the loss of blood to tissues, leading to their decay. Understanding its causes, types, and treatment options is crucial for effective management and prevention. Next, we go to the another presentation on the topic understanding gangrene, causes, types, and treatments. I would like to invite Dr. Sayyeda Iqbal Sayed for the presentation.
Hello, good evening everyone. I am Dr. Sayyeda Iqbal Sayyed, PG Scholar, MS Shalyatantra from Annasaheb Dange Ayurved Medical College, Ashta, Sangli. My topic name is Understanding Gangrene, Causes, Types and Treatment. Introduction to Gangrene. Definition. Gangrene is the death and decay of the body tissue due to lack of blood flow or bacterial infection. Key points. Can affect any part of the body, most commonly limbs, is a medical emergency that requires prompt treatment. Can lead to severe complications such as sepsis, organ failure, or even death. Causes of gangrene. Lack of blood flow, that is ischemia, blockage of blood vessels, for example, in peripheral artery, diseases, or diabetes. Reduced oxygen supply to tissue leading to cell death. Infection. Bacterial infection, for example, Clostridium in gas gangrene, can occur after injury, surgery, or untreated wounds. Trauma or injury. Severe injuries that cut off blood circulation or introduce infection. Burns or frostbite can also damage tissues. Chronic diseases. Diabetes, arteriosclerosis, or other conditions that impair circulation. Types of gangrene. There are four types of gangrene: dry gangrene, wet gangrene, gas gangrene, and internal gangrene. One is dry gangrene causes reduced blood flow, usually from conditions like diabetes or arteriosclerosis. Appearance: tissue becomes dry, shriveled, and discolored. Symptoms: pain, coldness, and numbness in the affected area. Treatment is surgical removal of dead tissue, debridement, or amputation if necessary. Wet gangrene causes infection leading to tissue death. Appearance: tissue is swollen, moist, and has a foul odor. Symptoms: redness, swelling, and fever. Treatment: antibiotics, surgical removal of tissue, and sometimes amputation. Gas gangrene. Some another information I want to tell you. Gas gangrene definition is: this is a rapid spreading infective gangrene of the muscle characterized by collection of gas in the muscle and subcutaneous tissue. As this condition is caused by Clostridial infection and it is also called Clostridial myonecrosis. Bacteriology is: gas gangrene is mainly caused by anaerobic Clostridial organism of which Clostridium perfringens, that is Clostridial welchii, is the main organism. Various types of gangrene, gas gangrene is Clostridium cellulitis, Clostridium single muscle type, group type, massive type, and fulminating type. In this single muscle type is the infection is limited to one muscle only. In group type, the gas gangrene is limited to one group of muscle, for example, extensor of the thigh or adductor of the thigh or glutei, etc. In this massive type, the gas gangrene involves almost the whole muscle of mass, one limb. Fulminating type, in this condition, gas gangrene spreads very rapidly, even beyond the limb, and is often associated with intense toxemia with high fatal rate. Causes is: infection by bacteria is Clostridium bacteria, which produce gas in the tissue. Appearance is swelling, severe pain, and has a disinfective foul odor. Symptoms: rapid spread, shock, and possible systemic infection. Treatment is immediate surgical intervention, antibiotics, and hyperbaric oxygen therapy. Treatment part is of gas gangrene. Prophylaxis, that is wound excision or debridement, administration of high dose of penicillin about 2 gram 4 hours leave always necessary. Whenever the wound is in tension, it is better to leave open than to apply primary sutures under tension. Active immunization has not been so popular in case of gas gangrene, yet nowadays toxide precipitated with alum APT is injected. Passive immunization by intramuscular injection of anti-gas gangrene serum of polyvalent antitoxins. Treatment of an established case. Supportive treatment. High dosage of penicillin should be administered and anti-gas gangrene serum which has been given. In this, risk factor for gas gangrene is or gangrene, poor circulation, conditions like diabetes, peripheral artery diseases, and heart diseases, infection, open wound, burns, or surgical wounds, trauma or injury, severe cuts, crushing injuries, or frostbite, immunocompromised status, individuals with weakened immune system, for example, due to cancer treatment. Smoking reduces blood flow and increases the risk of tissue damage. Symptoms of gangrene. Visible changes, color changes in the affected tissue from red to blue, purple, or black. Pain and numbness. Early pain followed by a loss of sensation as the tissue dies. Swelling and discharge, especially in wet or gas gangrene. Foul odor, a characteristic sign, especially in infected tissues. Systemic symptoms. fever, rapid heartbeat, confusion, and shock in severe cases. Diagnosis of gangrene, physical examination, checking the appearance and feel of the affected tissues. Imaging, X-ray, CT scan, or MRI to assess the extent of damage, especially in internal gangrene. Laboratory test, blood test to check for infection or organ damage. Tissue culture to identify the specific bacteria causing infection, especially in wet and gas gangrene. Treatment of gangrene, surgical intervention, debridement, remove of dead or infected tissue to prevent the spread of infection. Amputation, necessary when gangrene is widespread or severe to prevent further spread. Antibiotics, critical for treating bacterial infection, particularly in wet or gas gangrene. Broad spectrum antibiotics followed by targeted therapy once bacteria are identified. Hyperbaric oxygen therapy, used in gas gangrene to increase oxygen supply to tissue and slow bacterial growth, can help in healing tissue with limited blood supply. Supportive care, pain management, fluid resuscitation, and addressing underlying condition. For example, diabetes, heart disease, complication of gangrene, sepsis, life-threatening infection that can spread throughout the body, organ failure, if gangrene affects internal organ like the intestine or lungs, amputation required if the tissue death is widespread. Death, if untreated or not treated promptly, gangrene can lead to death. Conclusion. Gangrene is a serious and potentially life-threatening condition that requires immediate medical attention. Early detection and treatment are key to preventing severe complications, including amputation and death. Prevention through proper care of wounds, managing underlying conditions, and improving circulation is essential to reduce the risk. Okay, thank you.
Thank you, Doctor, for the well-explained presentation. Dear participants, we know that Rasaushadis or Ayurvedic mineral preparations play a significant role in treating respiratory disorders by detoxifying the body and enhancing lung function. To explore this topic, we have Dr. K. Tefila Visabil presenting on role of Rasaushadis in respiratory disorders. I'd like to invite Dr. Tefila for the presentation.
Namaste. My topic is role of Rasaushadis in respiratory disorder. Chronic introduction. Chronic obstructive pulmonary diseases, bronchial asthma, tuberculosis are the respiratory diseases which can be correlated with Swasaroga. In traditional medicines, nowadays we use herbal mineral and herbometallic, which are classically known as Rasaushadis. Rasaushadis can be said to be a boon to the traditional pharmaceutical sciences as they possess quick action, less dose, no issue of palatability, and long life. Thus it says in Sloka, Alpamatra Ubayogi Tatvat, Aruche Prasangatah, Shipramarogya Daitvat, Aushadebhyo Adhiko Rasaha. We have few Rasaushadis can be classified into 4 types as Karaliya Rasayana, Parpati Kalpana, Potali Kalpana, Kupi Pakwa Rasayana. Here I have mentioned a few Rasaushadis that can be used in respiratory disorders. Karaliya Rasayana, Lakshmi Vilasa Rasa, Swasakasa Chintamani Rasa, Chandramrita Rasa, in Parpati Kalpana, Rudra Parpati, Panchamrita Parpati, Rasa Parpati. Potali Rasayana, Hemagarbha Potali, Abraka Garbha Potali. Kupi Pakwa Rasayana, Rasa Sindura, Samira Panaga Rasa, Malla Sindura. We can see one in each medicines in detail. Karaliya Rasayana, Lakshmi Vilasa Rasa, ingredients, Abraka Basma, Lauha Basma, Lavanga, Ela, Shuddha Parada, Shuddha Gandhaka, Tamra Basma, Vanga Basma. Dosha Karma, Kafavata Hara, Kleda Hara, Anupana, Jala, dose 125 mg to 250 mg. Kasa Swasa Chintamani Rasa, ingredients, Shuddha Parada, Shuddha Gandhaka, Swarna Makshika Basma, Swarna Basma, Mukta Basma, Abraka Basma, Loha Basma. Dosha Karma, Kafahara, Shitoshna, Anupana, Pippali Churna, Madhu, dose 250 mg. Chandramrita Rasa, ingredients, Shuddha Parada, Shuddha Gandhaka, Loha Basma, Shuddha Tankana, Maricha Churna, Pippali Churna, Shundi Churna, Maricha Churna, Amalaki Churna, Vibhitaki Churna, Haritaki Churna, Chavya Churna, Dhanika, Jiraka, Saindava Churna. Karma, here the main ingredient is Tankana due to its Katurasa, Ushna Virya, Sara Tikshna Guna, Kafa Nishraka, and Shroto Shodhana property. The Bhavana Dravya is Vasa, which is well reported for its antitussive property. Dose is 9 Gunja. Next, we'll see about Parpati Kalpana, Rudra Parpati. Ingredients, Shuddha Parada, Shuddha Gandhaka, Eranda Swarasa, Adraka Swarasa, Bringaraja Swarasa, Kakamachi Swarasa, Shangapushpi Swarasa, Tamra Basma, Vatsanaba. Karma, the bitter taste drugs have their role in bronchodilation. The Tiktarasa present in the ingredients helps in easy breathing. The Shushkata can be rectified by Ushnavirya and Snigdha Guna in Eranda, Tamra, Kakamachi. Coughing episodes can be rectified by the antitussive drugs like Kakamachi and Shangapushpi. Next is Swarna Parpati. Ingredients, Shuddha Parada, Shuddha Gandhaka, Shuddha Swarna. Karma, in Adogami Rajakshma, Swarna Parpati reduces intestinal inflammation and clears Shrota Avarada and improves circulation of Rasadhatu. During purpuring, Kshayaroga is common in females, and in such conditions, Swarna Parpati helps in regaining strength. Swarna Parpati destroys Dosha Dushti in Rajakshma and improves Dhatu Pushti. Dose 1 by 20 gram to 1 by 10th gram. Anupana, ghee, honey, sugar candy. Duration once a day for 21 days to 42 days. Panchamrita Parpati. Ingredients, Shuddha Gandhaka, Shuddha Parada, Loha Basma, Abraka Basma, Tamra Basma. Karma, this is used in Swasa, Rajakshma, Adisara. The Rasa Yoga Sagara has mentioned Panchamrita Parpati is potent in Agni Deepana, Pachana, Kapha-nashana and Vata-shamana. It acts as an enhancer and revitalizer. Dose 250 mg. Potali Kalpana. Potali Kalpana means is concise, compact and make into a bundle or to different substance. Pocket of the substance. It is Hemagarbha Potali. Ingredients, Swarna Basma, Parada, Gandhaka, Tamra Basma. Karma, it was the property of Sarva Vyadi Nashaka. Swarna Basma has Madhura Rasa and used as Rasayana. Tamra Basma has qualities of Lekana and helps in Kapha Shamana. Parada acts as Yogavagi. Kupi Pakwa Rasayana. Malla Sindura. Ingredients, Parada, Rasakarpura, Gandhaka, Malla and Swarna Patra. Karma, Malla Sindura collected from the neck of the bottle and mixed with Swarna Basma. The bottom of the bottle is called Malla Chandrodaya. It destroys Kaphavata doshas. Dose 1 by half to 1 rati. Anupana, Haniya or Sitopaladi Churna 1 gram. For Kaphajev disorders, we can use Ardraka Swarasa and honey. Samira Panagrasa. Ingredients, Parada, Gandhaka, Haratala, Manashila and Gauri Pashana. Karma, this formulation was first described in Chandra Rasa Chandamshu. Manashila is not added in Rasa Chandamshu. The addition of Manashila is due to its Tikta Rasa Snigdha Ushna Guna. It acts as Kapha Vrikriti as it has Lekana property. Anupana, Nagavalli Swarasa. Rasa Sindura. Ingredients, Parada, Gandhaka. Karma, the word Rasa Sindura was first mentioned in Rasendra Chudamani, which contained mercury and sulfur prepared through Kupipakwa method. Discussion. Certain Rasaushadis have expectorant properties that helps in loosening and expelling mucus, clearing the airways. Rasaushadis like mercury or zinc have anti-inflammatory effects, reducing swelling in the respiratory passages. Rasaushadis like Swarnabhasma are believed to enhance immunity, which may help the body fight off respiratory infection. Conclusion: Rasaushadis have a great deal of promise for treating respiratory issues and balance the doshas, remove mucus, lower inflammation, and boost immunity. Formulations like Malla Sindura, Rasa Sindura are frequently used to treat long-term respiratory ailments like bronchitis, asthma, and persistent cough. Thank you.
Thank you, Doctor, for the well explained presentation. We know that Prameha, which encompasses various metabolic disorders, is closely related to diabetes mellitus type 2 in Ayurveda. Understanding its Ayurvedic management provides valuable insights into traditional treatment approaches. Presenting a case report on this, we have Dr. Mariam Muhammad Asif Baduda with her talk on Ayurvedic management of Prameha with special reference to diabetes mellitus type 2.
Good morning, everyone. Myself, Dr. Mariam, PG first year from Chikitsa Department of Dr. D.Y. Patil Ayurved College, Pune. Today, topic of presentation is Ayurvedic management of Prameha with special reference to diabetes mellitus type 2, guided by Dr. G.B. Varghese. Introduction. The word Prameha is derived from Mehati Sinchati Mutra Retency. It is a common metabolic disorder characterized by hyperglycemia due to impaired insulin activity. According to National Diabetes and Diabetic Retinopathy Survey, prevalence rate of diabetes is 9.8% and pre-diabetes is 11.8%. According to Ayurveda, Prameha is Tridoshaj Vyadhi and it is a group of urinary disorders increase in frequency of maturation and output. In modern medicine, its management is carried out by using anti-hyperglycemic agents and insulin. Disease-modifying drugs are used which have side effects. To avoid the complication and side effect of type 2 diabetes mellitus, we need the Ayurvedic management of Prameha. A 40 years old married male patient recently diagnosed with type 2 diabetes mellitus visited for consultation in Chikitsa OPD of Dr. D.Y. Patil Ayurved Hospital with complaints of अतिस्वेद प्रवृत्ति, दौर्बल्य, आलस्य, शुदा प्रवृत्ति, aggravated since past 2 months. No history of hypertension and any major illness were noted. हेतु कफ कर आहार सेवन, bakery products, meats, eggs, use of white sugar, sedentary lifestyle, stale food and curds. Clinical findings: we show अतिस्वेद प्रवृत्ति, दौर्बल्य, आलस्य, शुदा प्रवृत्ति. Since past 2 months, gradation is shown in the chart. Clinical examination, we do Ashtavid Pariksha and Dashvid Pariksha of patient. Line of treatment, Nidan Parivarjan, Agni Deepan, Aam Pachan, Tridosh Shaman, Pathya Palan, Guru, Aptarpan Janya, Kafahar Ahar Vihar, Yoga and Pranayam. Treatment plan. In Shaman Chikitsa, we give Vijay Sharadi Kara, Chandra Prabhavati and Sukha Sarakvati for duration of 1 month. Vijay Saradi Kara, which contains Vijaysar, Meshshungi, Haridra, Daru Haridra, Triplam, Musta, and Karvalyak powder, each 5 grams. We give 40 ml twice a day with lukewarm water. Chandra Prabhavati twice a day with lukewarm water. Sukh Sarakvati 3 Hs. Critical analysis of treatment. Drug and its mode of action. Vijaysar regulates the insulin production, whereas Meshshungi cause Deepan and destroys the sweet taste. Medohar Kafashamak. Haridra do Rakta Shodhan and it is also Deepan. Daru Haridra anti-diabetic agent. Trifla act as a virechan, removes the cough and pitta. Musta plays important role in hyperlipidemia and has the hypoglycemic action. Karvalyak Mehar helps to treat hyperlipidemia, digestive disorders. Chandra Prabhavati improves the blood sugar level, decrease the frequency of urination, anti-infective property, helps in improving metabolism. Suksarakvati Anuloman act as a laxative. Criteria of assessment. Subjective criteria Adhisvet Pravrutti, Daurvalya, Alasya, Shuddha Pravrutti, and objective parameters are fasting and PP blood sugar level before and after 1 month of treatment regime. Observation, we show the decrease in the subjective parameters as well as objective parameters, in which fasting blood sugar level decreased from 130 mg per dl to 96 mg per dl for fasting, and 4 pp 209 mg per dl to 132 mg per dl after treatment of 1 month. Lab reports are as shown in the pictures. Pramay shows similarity with type 2 diabetes mellitus described in modern texts. To avoid the long-term side effect and complication of oral hypoglycemic agents and cost-effective treatment of type 2 diabetes, we need the Ayurvedic medicine of Pramay is required. Aam Pachan Kafhar Deepan effect of Aushadhi Kalpa showed good result in both subjective and objective parameters of Prameha without any complication and side effects. Conclusion, it seems that physician can rely on single drug as well as formulation along with current hypoglycemic drug to improve management of diabetic patient. The observed result may be helpful in planning further scientific studies about the efficacy of these drugs on the prevention as well as management of Prameha. On the basis of this case study, we can consider this approach for further treatment and research workout for Prameha. Thank you.
Thank you, Dr. Mariam, for the well-explained presentation. Koshta and Agni are fundamental in Ayurveda, playing a crucial role in the success of Panchakarma therapies. Understanding their significance enhances the effectiveness of detoxification and rejuvenation treatments. Presenting on this topic, Dr. Rohini Rajendra Dan will present on this topic. I would like to invite Dr. Rohini Rajendra Dan. Dr. Rohini. Good evening, doctor. Dr. Rohini, we can hear your voice, doctor. Hello, Dr. Rohini. Can you hear me? Doctor, your voice is breaking, doctor. Can you please reconnect your headset, doctor? There is a problem in your headset, I think. Hello, Dr. Rohini. We can't hear, doctor. Can you please reconnect your headset, doctor? We can't hear, doctor. Hello, Dr. Rohini. Can you hear me? I think it was some connectivity problem. Next, we go to the another presentation. I would like to invite Dr. Mariam for the poster presentation.
Good morning, everyone. Myself, Dr. Mariam, PG first year from Kai Chikitsa Department of Dr. D.Y. Patil, Ayurveda College, Pune. Today, I will do the review of disease Ekakushta. In Charaka Samhita, Ekakushta is mentioned under the 11 Shudra Kushta. According to Charaka, Swedanam Mahapastu, Yanmatsya Shakalopavam, Tadekakushta Charmakya Bhaja Hasti Charmavat. That is, it is a disease in which skin shows dry, broad, fish scale-like patches, and skin becomes thick and rough. According to its sign and symptoms, we can compare it with the psoriasis. Psoriasis is an autoimmune chronic inflammatory skin condition typically characterized by raised, well-defined erythematous skin lesions of varying size that are characterized by silver white patches. It is a Vata Kapha Pradhan Shudra Kushtha, which is caused by sour, salty, spicy, oily foods, junk foods, आतप सेवन, दिवा स्वप्न, रात्रि जागरण, क्रोध, चिंता, etc. And it contaminates the रसरक्तत्वक मांसलसिका, रसवः स्रोतस, रक्तवः स्रोतस, and मांसवः स्रोतस. And it is seen on the skin. The Chikitsa Sutra. Shodhan Chikitsa is most important treatment for the Ekakushta. Vato Tairu Sarpi Vamanam Sleshmuttetairu Kushteshu Pitta Uttareshu Moksho Raktasya Virechanam Cha Agra. That is, in Vata Pradhan Ekakushta, Sarpipan is given first, in Kapha Pradhan Vaman is given first, in Pitta Pradhan Raktamokshan and Virechan is given first. Then, according to its dosha, we can give Shodhana Chikitsa, and then it is followed by Shamana Chikitsa and Apunarubhav Chikitsa. Thank you.
Thank you, Dr. Mariam. Thank you for the well-explained poster presentation. Next, I would like to invite Dr. Aditi Gadave for the presentation.
Good morning, everyone. Myself, Dr. Aditi Somnath Gadule, from Dr. D.Y. Patil College of Ayurveda. Today, our topic of presentation is an Ayurvedic approach in treating Shita Pitta in relationship with urticaria, a case study under the guidance of Dr. Vandana Ma'am. Shita Pitta, that is urticaria, is a disorder which is caused by asatma sevan and means that exposure to allergens and antibodies. Shita Pitta is caused due to cold air exposure, leading to disturbance of kapha and vata, which when combined with pitta circulates through the body and manifests symptoms on the skin. हेतु include आहारज विहारज निदान अर्थकारक रोग and चिकित्सा में in आहारज हेतु are संतर्पण अति लवण अति अम्ल कटु क्षार तीक्ष्ण मध्य सेवन विरुद्ध आहार सेवन अध्यशन गुरुद्रव्य स्निग्ध भोजन दधी विषयुक्त अन्नपान विहारज हेतु include शीत मारुत स्पर्श विषयुक्त जल अभ्यंग स्नान उद्वर्तन वस्त्र धारण दंश शिशिर ऋतु वर्षाकाल दिव्या स्वाप इन्सेक्ट बाइट right अति दिव्या स्वाप एक्सेट्रा निदान अर्थकारक रोग आर सन्निपातज पित्तज कफज ज्वर और अधोग अम्ल पित्त चिकित्सा मित्त योग हेतु आर वमन विरेचन following are the symptoms of Shita Pitta. That is inflammation like an insect bite, severe itching, excessive pain like pricking, vomiting, fever, burning sensation. And संप्राप्ति निदान सेवन अग्निमान्य leads to formation of along with the dosha प्रकोप प्रसरण of दोष दृश्य मूर्छना समूर्छना in आमाशय स्थानिक स्थान संशय and क्वश lead to शीत पित्त. In our college, a 32-year-old female patient came to Dr. D.Y. Patil College of Ayurveda having complaint of frequent eruptions of smooth red, slightly elevated papule or erythematous wheal on the trunk, face, and back for 1 month, which was gradually increasing. It was associated with generalized itching, burning sensation. The complaints got aggravated during evening and night time and on exposure to the cold and wind. The patient took allopathic medication and found relief, but the condition relapsed on discontinuing the medicine. The case was diagnosed as Shita Pitta on the basis of clinical representation and etiological and relieving factor. She had a complaint of malawas tumor on and off, and her jivva was sam. She was given Sooth Shekhar 2 BD, Gandhak Rasayan 2 BD, Chandraprabhavati 2 BD, Haridra Khandapal 3 mg BD, and Avipattikar Chudra 3 mg HS. Sarvanga and along with Shodhan Chikitsa, Sarvanga Snehan with Sarvanga Nadi Spid, a Tiktak Shir Basti, and for 7 days, and Shiraved was done on 7th and 21st day. Demographic test was done on her hand, and the result of before and after as shown on the slide above. After the following treatment, it was noticed that Shita Pitta is vitiation of Kapha and Vata due to Shita Amla Aharas. Shita Ahara, Kapha was dominant and Pitta was Anubandhi. In such conditions, Rota road was created by vitiated Kapha should be broken first. Charak has advised drugs along with Udarda Prashavan Mahakashana. Ushna Tikshna Lagu Gunatmak, Katu Tikta Rasatmak helps to normalize the vitiated Kapha and removes Rota. At the same time, Pitta achieved normal state after removal of Avrud. Haridra Khanda is the drug of choice for Shita Pitta mentioned by Bhaishajya Ratnavati. It is a potential anti-allergic drug and has antimicrobial and antibacterial properties. In Shita Pitta, there is Kapha and Pitta dominance. Ushna Tikshna Gunatmak Kapha Dalpa like Sooth Shekhar Ras can be helpful. Tikta Dravya Kshir Basti, which Shaman Chikitsa provides a is very effective in providing liberation of Shita Pitta. If disease is treated by breaking down of doshas and Nidan Parivarjan can absolutely be achieved. Thank you.
Thank you, Dr. Hadari. Thank you for the well-explained presentation. Next, I would like to invite Dr. Rohini Rajendra for the paper presentation. Dr. Rohini, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir. Am I audible?
Yes, doctor, you're audible.
Yes. Okay.
Your screen is visible, doctor. Please start the session.
Good evening, everyone. Myself, Dr. Rohini Rajendra Done, PG Panchakarma, final year student, Yashwant Ayurvedic College, postgraduate and training and research center, Kodoli, district Kolhapur. My guide name is Dr. Ravi Kumar B. Patil, associate professor and HOD, Department of Panchakarma, Yashwant Ayurvedic College, postgraduate training and research center, Kodoli. My topic name is importance of Kostha and Agni in Panchakarma. Then what is Panchakarma? Panchakarma is elimination of Bahu dosha and excessive doshas in Bahu or Bahu Ati Matra, that is excessive amount, through the Asana Marga, that is nearest root. Thus, all Panchakarma can be viewed under Purva Karma, that is pre-operative procedures, Pradhana Karma, that is main operative procedures, and Paschata Karma as post-operative procedures. Then what is Koshtha? Koshtha is Acharya Charka mentioned Koshtha as Mahasrotasa. It is said to be an Abhyantara Rogmarga. Koshtha is nature of bowel habit. Koshtha Pariksha is important in Panchakarma. It can be understood mainly by two methods, that is Anumana, inference, by giving Mrudu Anulamak Dravyas, mild laxatives like Kshira, Guda, Ikshurasa, etc. Prashna, and second one is Prashna Pariksha, that is interrogation, by asking directly with the patient about nature of bowel habit, frequency, consistency of stool. Type of Koshtha are Mrudu, Madhyama and Krura. Mrudu, that is Bahu Pitta, Madhyama, that is Samadosha, and Krura, that is Bahu Vata Shleshmana. Then what is Agni? Jatharagni means digestive fire. Jatharagni is present in Jathara, that is stomach and duodenum, the seat of Grahani, that is duodenum, and helps for Dhatu Paka. It helps for separation of Prasada, that is Prasada and Kitta Bhaga, and Bhutagni and Dhatavagni, that is partially digested food is exposed to Bhutagni, that is Parthiva Agni, digest Parthiva part of food. Likewise, every type of Agni digests its own type of food. The Agni responsible for nourishment of 7 dhatus is called as Dhatavagni. It exists in dhatus, that is tissue level itself. Agni Pariksha. Then how do we do Agni Pariksha? Assessment of digestive fire. Agni can be assessed by Abhyavarana Shakti and Jarana Shakti of subject. Abhyavarana Shakti, power of indigestion. That is, the amount of quality of food intake determines the Abhyavarana Shakti. And Jarana Shakti, that is power of digestion. If digestion process is proper, and then at the end of digestion, it will give rise to Jirna Ahara Lakshana, signs of complete digestion. Utsaha, that is enthusiasm. Laguta, that is lightness. Udgara Shuddhi, that is clear belching. Shudha Tikshna Pravrutti, hunger and thirst in Shidha Trishna Pravritti, that is hunger and thirst in proper time, and Yathochita Malasarga, timely evacuation of feces, are the symptoms of proper digestion. Role of Koshtha and Agni in Panchakarma. Then first of all, Dipana, that is increasing Agni, and Pachana, digestion of Before the administration of Sneha, one must administer mild medicines such as increases the Agni and bring the Laghuta, lightness in the Koshtha. If Shodhana is administered in Ama Avastha, it will hamper the body just like extracting juice from unripened fruit. Rukshana, second one is Rukshana, dryness therapy. Improper Rukshana may lead to Agni Balanasha, that is depletion of digestive fire. Snehana, that is oleation therapy. Snehana refers to administration of oily substance. In Abhyantara Snehapan, Koshtha helps for deciding number of days of Snehapana, and Agni helps for fixing the dose of Aushadha. Based on Koshtha, Snehapana can be given for 3 to 7 days, and based on Agni Bala, that is digestive fire. Rasva, Madhya, Uttama Matras can be given for the persons having Mandagni, Madhyamagni, and Uttamagni respectively. If Koshtha is unknown, Snehapan can start the Rishiyasi. We can start Rishiyasi Matra, that is test dose. In Svedana, the Samyak Svedana helps for Agni Dipti, and Shodhananga helps for bring the doshas from Shakha to Koshtha. Fifth one is Shodhana. Shodhana medicine is decided. That is Shodhana includes Vamana, Virechana, Basti, all these Pradhana Karma procedures. Shodhana medicines is decided based on koshta of the patient. For Mrudu koshta patient, lesser dose, Madhyama koshta, medium dose, and Krura koshta, high dose medicines has to be given. In Paschata Karma, Shodhana leads to elimination of doshas from body, resulting in Agni Sandhushana. Therefore, one has to follow the Sansarjan Karma to restore the strength of Agni. Hence, in all this Agni and Koshta Pariksha is very important. The concept of Koshta and Agni has significant role in Panchakarma, while selection of dose of drug, selection of different treatment modalities for a disease. Koshta and Agni Pariksha is helpful in Purva Karma to decide the number of days and dose of Snehapana. Pradhana Karma to decide the drug for Shodhana, and also in Shamana Chikitsa. Koshta Pariksha reveals the predominance of dosha and helps the physician to judge the line of treatment and can advise what to do and what not to do. Thank you, sir. Thank you, everyone.
Thank you, Dr. Rogni. Thank you for the wonderful presentation.
Thank you so much, sir.
Next, we go to the poster presentation. I would like to invite Dr. Aditi Gadave for the poster presentation.
Good morning, everyone. Myself, Dr. Aditi Somnath from Dr. D.Y. Patil College of Ayurveda, Kaya Chikitsa Department. Today, my topic of presentation is role of Ayurveda in prevention of lifestyle disorder under the guidance of Dr. Vandana Bukadi, ma'am. Lifestyle disorders are those health problems that react to the change in our lifestyle, such as habits, behavior, and practices. Lifestyle risk factors have only one common property, that is, they make breathing heavier and our body oxygen level low. They are also known as non-communicable diseases. The main aim of Ayurveda in the lifestyle disorder is its prevention and early diagnosis. Yes, the causative factor for such diseases are processed food, stress, lack of sleep, smoking, alcohol, lack of socializing, inactivity, unhealthy diet, which leads to disorders such as thyroid, anxiety, diabetes, cancer, obesity, PCOS, heart diseases, hormonal imbalance, hypertension, etc. So, to reduce such, one must adapt Ayurvedic lifestyle in their daily routine, such as Dinacharya, Rutucharya, and Brahmacharya. Dinacharya includes Brahme Murte Uttishte, that is waking up early in the morning, that is at Brahma Murta, then Dantadhavan, Gandush, eye care, exercise, massage, if not possible daily, Pada Abhyanga, Shiro Abhyanga, bathing, medication, and early sleep. If, one can also follow Rutucharya, that is seasonal regimen. That is, in every Rutu there is prakop of certain doshas, such as in Shishir Rutu there is dominance of Pitta dosha. In Varsha Rutu there is dominance of Vata dosha, and in Vasanta Rutu there is dominance of Kapha dosha. So one can do panchakarma accordingly, such as in Shishir Rutu one should do Virechan, in Varsha Rutu one must do Basti, and in Vasanta Rutu one must do Vaman to maintain the Sama Avastha of dosha. Sama dosha, Sama Dhatu, Sama Agni leads to healthy lifestyle. Ayurveda provides various procedures to manage lifestyle disorders such as Dinacharya, that is daily regimen, Rutucharya, that is seasonal regimen, Panchakarma, such as Vaman, Virechan, Basti, Nasya, Rakta Mokshan, and Rasayan and Sadavrutta. By correcting the dosh, Dushya, and Agni, and by doing Samprapti Vigatan, yoga, Vyayam, gives strength to the body and reduces risk factors of non-communicable diseases and increases quality of the life. Thank you.
Thank you, Dr. Aditi. Thank you for the wonderful presentation. Next, I would like to invite Dr. Abhilash Balasaheb Ahire for the poster presentation.
Hello, good evening, everyone. Myself, Dr. Abhilasha Vaitsar from Dr. D.Y. Patil Ayurved College and Research Center, Pipri, Pune, and I am presenting a poster on review of Nasya Chikitsa to the Srotas in geriatric disorder under the guidance of Dr. Varghese sir. Firstly, we see introduction. Ayurveda has focused branch of medicine called Rasayan, which exclusively deals with the problems to aging and the methods to counter the same. Geriatrics or Jara Chikitsa or Rasayan Chikitsa in Ayurveda is the method to control or to slow down the aging process in the human being during the degenerative phase of one's life. Aim is to review on Rasayan Chikitsa according to Srotas in geriatric disorders. Objective is to study Rasayan Chikitsa in various geriatric disorders according to Srotas. So, according to Srotas, we use following Rasayan. Firstly, Pranava Srotas. Dushti Hetu is Vega Dharan, Ruksha Ahar Vihar, Langhan. Geriatric disorders include Hikka, Shwas, Kas, and Rasayan we use Pimpri, Bhallatak, Amalki. Next is Udakva Srotas. Bhay, Trishna, Veg, Dharan are the Dushti Hetus. Geriatric disorders include Trishna. Rasayan we use are all fruit juices. Next is the Annava Srotas. Dushti Hetu is Aniyamit Ahar Sevan Kal, Ahitkar Ahar. Geriatric disorders include Mukhapak, Aruchi, Adman, Amla Pitta, and Shankha Bhasma and Kapardik Bhasma and Parpati are used as a rasayan. Next is the Rasava Srotas. Guru Shitahar, Atisnigdahar are the Dushti Hetus. Geriatric disorders include Pandu, Vyanga, wrinkles, Agnimandya, and Yashti Madhu, Guduchi, Draksha, and Shunti are the used as a rasayan. Then Raktava Srotas, Vidahi, Snigdha, Viruddhahar Sevan are the Dushti Hetus. Gudapak, Vyanga, Mukhapak, Tvakadushti are the geriatric disorders, and Manjishtha, Amalki, Saiva, and Nimba are used as a rasayan. Then Masva Srotas, Abhishandi, Guru Ahar Sevan are the Dushti Hetus. Adhimas, Arbut are the geriatric disorders, and Suvarna Bhasma, Shuddha Karaskar are used as a rasayan in Masva Srota. Then Medova Srotas, अव्यायाम दिवा स्वाप स्निग्ध गृह आहार सेवन अर्धदुष्टी हेतूस स्थौल्य अतिस्वेद प्रवृत्ती मधुमेह are the geriatric disorders, and Guggulu, Trifala, and Shilajit are used as a rasayan in these srotas. Then Astiva srotas, Ati Vyayam, Ati Chakraman, and Aghat are the Dushti Hetus. Sandhigatvat, Astishay are the geriatric disorders, and Abha, Asti Shrunkala, and Shalika are used as a rasayan srotas. Majjava srotas, अभिसंधी आहार विरुद्ध आहार सेवन आणि अभिघात अर्धदृष्टी हेतूच भ्रम तमप्रवेश मूर्छा संधी प्रदेशी वेदना are the geriatric disorders, and रौप्य भस्म भृंगराज वचा ब्राह्मी शंखपुष्पी are used as a rasayan in majjava srotas. Then शुक्रव स्रोतस अतिव्यवाय शुक्रवेग धारण अर्धदृष्टी हेतूच सकष्ट शुक्र प्रवृत्ती is the uh, geriatric disorders, and Shilajit, Ashwagandha are used as a rasayan. Then Purishva Srotas, Purishvek Dharan and Ajirnashan are the Dushti Hetus. Malavibandha, Sakashta Mala Pravriti are geriatric disorders. Kutas, Srifal, and Bilwa are used as a rasayan. Then Mutravra Srotas, Mutravek Dharan, less water intake are the Dushti Hetus. Bahumutrata, Mutrakruchata are the geriatric disorders, and Gokshur, Punarnava, and Varun are used as a rasayan. According to above, we discuss as per the Ayurvedic principle, the aging is a natural phenomenon of life. Charak Samhita mentions that functional diminution of dhatu, oja, strength of a sense organs, power of cognition, strength of body gradually decreasing during the old age. So, because of rasayan drugs and therapeutic measures act on a dhatu, agni, srotas, and produce healthy tissue development in the body, and in turn it provide a person longevity, immunity, resistance against disease, strength, happiness, and intellect promotion in the mind. So we concluded that hence it can be concluded that the Srotas Parikshan plays an important role while treating the patient with Rasayan Chikitsa. Thank you.
Thank you, Dr. Abhilasha. Thank you for the well-explained presentation. Next, we go to the another poster presentation. I'd like to invite Dr. Shweta Prakash Patil for the poster presentation.
Good evening, everyone. Myself, Dr. Shweta Prakash Patil, MD Scholar Kai Chikitsa from Dr. D.Y. Patil Ayurvedic College, Pimpri, Pune. My topic of presentation is decoding the treatment principle of the Grudrasi under the guidance of Dr. Abhijit Shekhar sir. Introduction. Grudrasi is derived from the Sanskrit word gridra, that means vulture. In this disease, the gait of the person resembles to that of the vulture. Aim. Literature review of treatment principle of the Grudrasi according to the various acharyas, material and methods. A thorough review of the Brihatre, Lagutre and the article has been done. There is Chikitsa is according to Shaman Chikitsa and the Shodhan Chikitsa. Shodhan Chikitsa according to the various Samhitas are as follows. According to the Charak Samhita, they mention Nirho Basti, Anuvasan Basti, Sira Ved, and Agni Karma. According to Sushrut Samhita, as Sushrut Acharya, they mention Sira Ved. According to the Ashtang Hruday, they mention Anuvasan Basti, Sira Ved, and the Agni Karma. According to the Vangasen Acharya, they mention Snehan, Svedan, Vaman, Virechan, Nirho Basti, Anuvasan Basti, Siravet, and the Agni Karma and the Shastra Karma. According to the Chakradatta Acharya, they mention Snehan, Svedan, Vaman, Virechan, Anuvasan Basti, Siravet, and Agni Karma and the Shastra Karma. The discussion. Grudrasi is a Vatas Nanatmaj Vati. It involves Shaman Chikitsa and the Shodhan Chikitsa, Shaman Chikitsa, which aims to balance the body's dosha. In case of the severe dosha accumulation, Shodhan therapies are recommended to detoxify the body. Dietary recommendation and emphasize warm, easily digestible food to pacify the Vata and Kapha doshas. In Shaman Chikitsa, they mention Rasayana Chikitsa means Apunarbhav Chikitsa, Dipan Pachan Aushadhi, Vat Kapha Shamak Aushadhi, Abhantar Snehan with Eranda Tel, Patya Apatya, Palan, Nidan Parivarchan. Conclusion. Rudrasi is a debilitating condition that disturbs a person's ability to sit and walk comfortably, significantly impacting their daily routine. With the help of Ayurvedic principle, one can effectively manage the disease. Furthermore, it also prevents recurrence by addressing the root. Thank you.
Thank you, Dr. Shweta Prakash Patil. Thank you for the wonderful presentation. Next, we go to the sciatica related case study. I would like to invite Dr. Kushnak Vijay for the paper presentation.
Good morning, everyone. Myself, Dr. Shubhangi Shahu PG scholar from Department of Kai Chikitsa. The title of paper presentation is Ayurvedic Management of Gridresi in relation to sciatica, a case report guided by Dr. D.G. Dipankar sir, MD Kai Chikitsa from BHU, Professor Department of Kai Chikitsa. Introduction. Gridresi is an Ayurvedic term describing sciatica, which correlate pain radiate from the lower back to the legs due to sciatic nerve irritation, which particularly affect Van which affect the nervous system. The mainly symptoms are pain and difficulty in movement, performing daily activities like standing or walking. Then sciatica is a condition characterized by pain radiating along the sciatic nerve, which extend from lower back down over both the legs, which resembling the gait of vulture like Gridra. in Ayurvedic text. The feature of sciatica are closely aligned with Gridrasi. In Gridrasi, pain originated from speak means hip, radiate to the Kati means prushted as lower back, Uru thigh, Januk knee, Janga calf, and Pada foot. Along with the pain, symptoms of Gridrasi may include stiffness, heaviness, which vary depending on the involvement of specific doshas. So the present case study, the presenting complex of 45-year-old female patient visited for consultation in Kai Chikitsa OPD of Dr. D.Y. Patil Ayurveda Hospital, presented with the complaints of the chief complaints are pain in lower back region radiating to the left leg from 6 months, stiffness in the lower back region and left leg 6 months, tingling sensation in the left leg from 5 months, heaviness in both legs from 5 months, difficulty and pain while walking and bending forward from 5 months, pain in cervical region from 2 months. Past history, there is no any past history. Hetu that Vatvardak Ahar Vihar, irregular eating habits, and excessive intakes of legumes and beans. On clinical examination, and the inspection shows the patient having limping gait, discomfort in walking and sitting for long duration, no localized swelling, no varicosities, reflexes are intact on palpation, tenderness 2+ at L4 L5 region, muscle tone good, muscle power grade, right extremities upper and lower 5/5, left extremities upper and lower 5/5. Special test SLR, so right leg positive at 40 and left leg positive at 30, Braggart's test positive on left leg. The samprapti of the Gridrasi shows हेतू 7 वातदोष प्रकोपा स्रोतस स्थान वैगुण्य रिक्त स्रोतस व्यान पूर्ण होतं शिरा धमनी गेट occupied by the Vat, Gridrvat Chalan, Katitupat radiating pain, so that the Gridrasi is developed. Samprapti Ghatak include dosha like Vata and Kapha, Dusha, Rasa, Rakta, Asti, Majja, Sira, Kandar, and Snayu. So the treatment plan was the Shaman Chikitsa include first one is the Agni Thundivati, doses is the 125 mg 2 BD before food with lukewarm water for 21 days. Parijata Ghanavati 250 mg 2 BD after food with lukewarm water for 21 days. Trayodasham Gogo 250 mg 2 BD after food with lukewarm water for 21 days. Ekanga Viras 125 mg 2 BD after food with lukewarm water for 21 days. Sarakvati 500 mg 2 HS bedtime with lukewarm water for 21 days. The Shodhan Chikitsa include Sthanik Snehan with Balatel, Katitu Ubhaypat for 21 days, Sthanik Nadi Svedan with Dashmurkwat for 21 days, Kati Basti with Balatel for 21 days, Basti, which include Anavasan Basti with Balatel 80 ml and Niro Basti with Dashmurkwat 780 ml alternate days for 21 days. Siravet should be done on 7th and 18th day, which will be 4 angul above Janu Sandhi and 4 angul below Janu Sandhi, and Agni Karma at Kati Pradeshi on 5th and 15th day. Observation shows keep pain in lower back region, radiating left leg on the 0 day is the 6+ by using VAR score, and on 7th and 14th day is a 5+ or 3+, and 21 day is 0. Stiffness in the lower back region on the 0 day is 3+, on 7 day 2+, on 14 day 1+, and 21 day is 0. That's the difficulty and pain while walking and bending forward on 0 day 6+, on 7 day 5+, on 14 days 4+, and on 21 day is 1+ by using VAR score. Pain in cervical region on 0 days 3+, and on 21 days 1+ by using VAR score. The observation or the test include SLRT. On 0 day, right leg is positive at 40. On 7 day, positive at 50. On 14 day, positive at 60. And on 21 day, right leg SLRT is negative. Of the left leg is positive at 30 on 0 day. On 7 days, positive at 40. On 14 day, positive at 50. And on 21 day is positive at 60. Braggart states right leg negative on right leg negative on 0 day, and left leg is positive. And on 21 day, both leg are negative. Gait the on 0 day is a limping gait. On a 21 there is no limping gait. Discussion includes Shaman Chikitsa, Agni Thundivati, which contain Kupulu, which act as a Deepan and Pachana, Vat Shamak and Shulagna, Parijata Ganavati, which act as anti-inflammatory, analgesic and Kafagna and Vathar, Ekanga Viras, which eliminates Rota Varat due to Ama and Kapha, Trayodushan Gugur, anti-inflammatory, analgesic and muscle relaxant, Sarakvati, which act as an Anuloman. Then Shodhan Chikitsa includes Snehan, which reduces stiffness and the pain, which reduces Svedan, that is which reduces Vata by promoting sweating and softening of the stiff muscle. Basti therapy mainly nourishes and strengthens the body, particularly the lower back and the nervous system. Kati Basti, where medicated oil is retained over the lower back, is especially beneficial for condition like Gridrasi. Agni Karma provide pain relief by stimulating the nervous system. Rakta Mokshan improves circulation and elevates the brain. Conclusion, sciatica, that is the gridresi, can be cured effectively with the collaborative approach of the various panchakarma and shaman chikitsa without causing any adverse event and prevention of the surgical intervention. The therapies work together to restore flexibility, improve the nerve health, and promote healing in the sciatica nerve and surrounding tissue. This therapy help reduce pain, stiffness, and inflammation, and improve circulation, which is the key in managing the discomfort of gridresi.
Thank you, Dr. Kushtang. Thank you for the paper presentation. We know that music therapy has long been recognized in Ayurveda for its powerful healing properties, promoting mental and emotional well-being. Exploring this therapeutic journey through sound offers unique insights into traditional health. Next, I would like to invite Dr. Prasad Hanumandas Kalya for the poster presentation on the topic Echoes of Healing, the Therapeutic Journey Through Music. Dr. Prasad,
Yes,
are you
sir.
there?
Yes, sir. Yes. Am I audible, sir?
Yeah. Good evening, doctor. You are audible.
Good evening. Good evening. I will share my screen.
Your screen is sharing, doctor.
Okay, sir.
Now your screen is visible, doctor. Please start the session.
Okay, okay, sir. This thing. Yes, sir. Is my screen visible, sir?
Yes, doctor. Your screen is visible, doctor. Please start the session.
Okay, okay. Namaskaram and good evening to everyone. My name is Vaidya Prasad Kalya, PG scholar in Ayurveda, Samhita Evam Siddhanta Department from Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. Today, I am delighted to present my poster on the topic Echoes of Healing, the Therapeutic Journey Through Music. Introducing music therapy, according to AMTA, American Music Therapy Association, music therapy is the clinical and evidence-based use of music intervention to accomplish individualized goal within a therapeutic relationship to promote wellness, manage stress, anxiety, etc. There are two types of music therapy, mainly active and passive. Active is singing and playing of songs. Passive is listening to the music. Domains of music therapy includes physical, social, spiritual, emotional, communicative, and cognitive. The biorhythm clock tracks your physical emotions and intellectual cycles. For example, one might feel more energetic in the morning and more creative in the evening. By choosing music that matches current biorhythm phase, one can enhance mood or productivity. On the other hand, the Ayurvedic clock divides the day into specific dosha periods, Vata, Pitta, and Kapha. Each dosha represents different qualities and influences body and mind. Interrelating the two, we can say that just as biorhythm clock helps you choose music that fits your energy levels, the Ayurveda clock helps you schedule your daily activities based on body natural rhythm. Example, during Vata and Pitta dominance, one might choose soothing music, which reduces Vata and Pitta, and in Kapha dominance, upbeat music could help increase energy and lessen alasya like Lakshana of Kapha. Music therapy in Ayurveda. In Vimanstan, Charakacharya says, Shruti, Sukham Mrudu, Madhura Mano, Anuganam, Cha GitaVatitranam, Shravanam. In Pittach Prakriti, Acharya says, hearing of songs and music which are pleasing to ears. In Charak Sutra, first Adhyay, Shariram Sattva Saitnincha, Vyadi Nama Shrayo Mataha, Tata Sukhana. In this, we can infer that Sharir and Mana both are accepted as site for diseases as well as pleasure. Also, in Charak Vimanstana, Charaka explained Paraspara Anuvartamanaha. In explaining this, Acharya Chakrapani elaborates it saying Atra Chapara Shabdena, Sharirana Sharirena, Manasana Manasena, Sharirana Manasena, and Manasana Sharirena Cha Anubandho Niyaha. Both Sharir and Manas are related with each other. As Aushadha first acts on Sharir dosha, then Mansik dosha, same like music therapy acts on Manasik dosha first and then Sharirik dosha second. Now it can be inferred that music therapy elevates feeling of Vishada, that is depression, by pacifying Vata and Pitta. It creates Ashvasana and Vismarana of Dukha and effect. Hence, thoughts and memories of diseases from the mind is eliminated. Also, music along with Ayurvedic treatment show positive effect with good quality health. Also in Charaka Chikitsa, they have explained Kama Shokat Bhayat Vayu and Krodhat Pittam. So in this, music therapy acts well. Thank you. Thank you, sir.
Thank you, Dr. Prasad. Thank you for the well explained presentation.
Thank you.
Next, we go to the another paper presentation. I would like to invite Dr. Devayani P. Dasar for the paper presentation.
I'm audible, sir?
Yes, Doctor, you're audible. Good evening, Doctor.
Good evening, sir. May I share the screen?
Sure, Doctor. Please share, Doctor. Your screen is visible, Doctor.
Yes. Thank you so much. So good evening to all. Myself, Dr. Devyani P. Dasar, Associate Professor from Department of Shalya Tantra from of Mahatma Gandhi Ayurveda College, Hospital and Research Center, which is a constituent unit of Datta Meghe Institute of Higher Education and Research. I'm going to present on the role of Changiri Kruta P2 in partial rectal prolapse in infants, a case series. These are the case studies prospectives having the introduction, aim, objectives with observation, discussion, and conclusion. So actually, this rectal prolapse is the some mass is going to come out through the anus that parents that the patient's parents they are complaining to us, and it occurs at the 12 months to 5 years age, but it is idiopathic in nature in terms of the infants. Acharya Sushruta has well said about the pravahana atisarabhyam nirgachati gudam bahi ruksha durbalya dehasya tam gudabhramsham adi sheta. So, because of this pravahana and sometimes that constipation, it causes the rukshata durbalta dehasya. So that's why that valis, guda valis that are going to come out. So here is the anatomical presentation of this. Here we are going to see the normal anus and this is the prolapse rectum, which one is the partial one. The treatment available in the modern is the manual reduction first, then sclerotherapy, tear stitch, and reconstruction surgeries. And according to our Acharya Sushruta, Gudabhrante Gudam Swinnam Sneha Bhekta Pravechayita Snehana Swedana, also Gofana Bandha, then Swedayasha Muhurmuhu, and also Changiri Ghruta. It reference as taken from the Tarak Sushrut Bhav Prakash Nighantu, and it has a very good. If I found the very good effect in this one. So aim behind this series was the assessment of that effect of Changiri Ghrit in the partial rectal prolapse in infants with the objective of the same. Now, this a male child of the age 16 to 20 months received that came to OPD with the parents complaining of sometimes there are mild drops of bleeding on the claw since 15 to 30 days and something that mass is going to come out of the anal region. There was no any long use of any medications. Here is the local examination. We can see the protruded mass coming out through the anus. And after local examination and little Snehana Swedana, as these are the infants, so we have given the mild Snehana Swedana with the hands of mother only. So Amalki Churna was given and the Changiri Ghruta P2 applied twice daily locally for the 21 days. And the follow-up was taken up to the 2 weeks. So here we are going, here is, in this one we can see that is a very most efficacious found in this trial. So Changili Grut contains actually the Amla Kashayarasa Laghu Ruksha, Amla Vipakaha, and a Kapha Vatahara properties. And also it has the anti-inflammatory, antiseptic with the infection control and nourishes the gastrointestinal mucosa. So it lubricates it and enhances the fat-soluble vitamins and strengthens the colonic flora. So that results to the wellies that are going to come out of the anus that is going to the normal position one. So Shangiri growth which is found effective in this partial rectal prolapse. So it definitely inhibits the sclerotherapy and further surgical corrections in infants, and it is very easy to prepare. Not only in the this infant, but I also tried for the 80 years of patients who have given a very good result just by the Changiri Growth. And these are the references. Thank you so much, organizers, for giving this opportunity to me to present over here. Thank you.
Thank you, doctor. Thank you very much for explaining about Changiri Grita in such an easy, understandable way. Thank you so much, doctor. Next, we go to the another poster presentation. I would like to invite Dr. Khushnak Vijay for the poster presentation.
Good morning, everyone. Myself, Dr. Kushang Vijay More. Today, our topic of poster presentation is infertility and the Ayurveda, guided by Dr. D.G. Dipankar sir, MD Kai Chikitsa BHU. So, what is the infertility? Failure to conceive within 1 year of regular unprotected coitus. So, the causes of infertility in males and females. In males, these are the systemic defects, coital dysfunction, sperm defect, pathological, and in females, that is the systematic defects, coital dysfunction, anevolution, and pathological causes. According to Ayurveda, there is Arthadushti, Yoni Vapad, Yoni Arsha, Arthavah Srotavrat, Atibala and Riddha, Mansik Abhitab, Mithyachar, Bijatosh, and the Daiva. Factor responsible for fertility that are Rutu, Kshetra, Bij, and Ambu. Ritu including proliferative phase, Kshetra, healthy female genital tract, Bija, ovum and sperm, Ambu, metabolic products, example glycogen and hormones. Management including Agnidipan and the Ampachan, Tridosha Shamana, especially Vata, Shodhan, Vaman, Virechan, Uttarvasti, Nasya, lifestyle modification, including healthy diet, pit addictions, exercise, yoga, including Surya Namaskar, Paschimottanasana, Brahmari, Pranayam, Ayurvedic formulations, including Shukra Shodhan Gana, Prajasthapan Gan, Sukumar Grita, Ashwagandha Grit, Falagrit, Kanchanar Gugud, Aragavardhanvati, Ashokarishta, treatment of responsible causes, Yoni Vapad, Shukra Dosha, and Artho Dosha. Thank you.
Thank you, doctor. Thank you for the poster presentation. Next, we go to the another paper presentation. I would like to invite Dr. Mayur Sandesh Patil for the paper presentation.
Good morning, all of you. Today, my topic of presentation: Man Manas Rog and their management, a literary review by Dr. Mayur Patel under the guidance of Dr. G.B. Varghese sir. In this slide, we can see the definition of health according to the WHO: a complete physical, mental, or social beings, and not merely the absence of disease or infirmity. Trials of life. In Ayurveda, the triads of life is Sattva, Atma, and Sharir is the crucial maintaining mental well-being. Nowadays, we can see the mental disorder are the leading cause of non-fatal disease burden in India. In 2017, 197.3 million people in India had a mental disorder, including 45.7 million with depressive disorder and 44.9 million with anxiety disorder. Attributes of mind. The mind of in Ayurveda has three primary attributes: Sattva, Raja, and Tamas. Raja and Tamas are considered reactive tendency and that leading to the emotional imbalance and the psychological disturbance. According to the Ayurveda, there are three Sharir dosh, that is Vatas, Pittas, and Kapas, are believed to the influence the health of body. Disease is attributed to the three main factors in Ayurveda: is Satmindartha Sanyog, Prajnaparat, and Parinam. Impact of gunas on mental health. Rajas and Tamas are overshadow Sattva, leading to the Manas Rog. Understanding the Mana and Manas Rog is essential for maintaining the Sattva. Aim and objectives: to study the concept of Man and Manas Rog according to Ayurveda, to study the prevention and management of Manas Rog according to the Ayurveda. Materials and methods. This study use Ayurvedic text, dictionaries, and internet source to analyze the Charak Samhita, Shushan Samhita, Ashtang Hriday, Madhav Nidan, and their commentaries for the literary and conceptual analysis. In this slide, we can see that the man develops in the fifth month of intrauterine life and Nirukti according to the Sabdakosh. Manas is entity by which we can think about everything. It is responsible for thinking or for analyze. According to the Amarkosh, mind is entity through which the knowledge is obtained, which is closely related with Atma, through which one can perceive, and the seat of Mana in Hriday. Synonyms of mind: Sattva, Chitta, Chetas. Gunas of Man. Charak mentioned two gunas of Man, Anutvam and Ekapam. Mano Artha, Chintam, Vicharya, Viham, Deha, Sankalpa. That is thoughtfulness, reasoning, logic, logical interpretation, goal and aim, resolution, determination. And in this slide, Manoshrotas, in Charakshita, Manoshrotas is mentioned in Sharistan 1, in Indrastan 5, and Chikitsasan 9. The body as a whole is a habitat of mind, and all shrotas are considered part of Manoshrotas. Manas Rogs, some Samanya Samprapti, Nidan, then Sharirik and Masik Dosh, that is Vat Pitta, Kaf, Raja, Tama, Hridayashrit, Manoshrotas Dushti, Masik Rog. Classification of Manovikar, that is Manoadhishtan, Ubhay Adhishtan, and Nanatmas Manovikar. Manovikar Samanya Chikitsa, line of treatment. Ayurvedic medicine has traditionally used mental stimulation to lessen the effect of illness. Trivit Chikitsa is advised by Ayurveda to cure the mental disorder. That is first, Devya Prashay Chikitsa, Yukti Prashay Chikitsa, and Anparijaman. Sanchodhan treatment procedure, that is woman, Virechan, Basti, Nasya, Abhangya, Takradhara, Shirobasti, Shiropichudhara, Shirolep, Anjan. When Sanchodhan and Rasayan therapies are applied correctly, a disordered mind can be brought back to the normal. Then we can use Sanchaman Chikitsa. First, Rasunadhi. In this, we can use Smriti Sagar Ras, Unmat Gajakush Ras, Brihat Kasturi Bhairav Ras, Invati Vati, Brahmi Vati, then Dhanvantari Gutika, etc. So Arishta, Ashwagandha Arishta, Saraswat Arishta, etc. Churna, Ashwagandha, Jatamansi, Jyotishmati Churna, Grit, Kalyanak Growth, Maha, Vaishakrut, etc. Tel, Chandanadi tel, Himsagar tel, etc. Rasayan, Chavanpraj, Brahma Rasayan, etc. In this medicine, we can Aharyogi Chikitsa, that is cause of surprise, causation of spirit, causing factor, traits, binding, etc. Ayurvedic psychotherapy, we can use assurance, emotional repressment, regulation of thoughts, then challenging presumption, correlation of objectives and ideas, guidance for decision making, control of patients, etc. Nasya Chikitsa, absolute eradication of mischief by eliminating desire, the root cause of a mischief. Yoga practice involves the practice yoga for salvation, increase the sattva, decrease raja and tama, improve blood circulation, focus the mind, reduce stress. These all are the benefits of yoga practice. Discussion and conclusion. Mental problems are being more common nowadays. World rapid globalization, poor lifestyle, stress, and other issues. Treating this growing issue using Ayurvedic principle and instruction can be quite effective. The body and mind are interconnected, and attaining a proper diet, lifestyle, and the ethical conduct can help and manage the Manas Roga, promoting all the beings. The article highlights the significance of Manas and its function in the etiology, symptoms, classification, and treatment principle in Manas Roga Vigyan, highlighting the potential of Ayurveda mental health. Thank you.
Thank you, doctor. Next, we go to the single drug management of Venga.
All of you. Today, my poster presentation topic is single drug management of Venga Bas Jati Phal Churna. Introduction. Venga is the one of the most in the Kushtrog characterized by penless Shavarna mandal, that is bluish black patches along with the Kandu Daha, especially occurring on the face. Venga can be correlated with the hyperpigmentation with the special reference of melasma. Based on its clinical features, Lepa is mentioned under the Bahya Aparichamarangya Chikitsa. It corrects the Brajakpitta located in the skin by the absorbing the drug into the body through the skin. Objective to study the role of Jatifala Churna leaf in with Madhu in the management of Venga. Jatifala, Latin name is Maestrica faringens, Rasakatu Tiktakasha, Virya Ushna, Vipakatu, Guna Logu Snigda Tishna Karma Kaf Vat Shamak. Case study: a 42 years old male patient presented with complaints Mukh Pradeshi Krishna Vaivarnya Kandu and on his face and nose since 50 to 20 days. Management. Zatifal Churna leaf is mentioned in Bhav Prakash and Charak Datta for Venga management. For the management of Venga, the formulation of Zatifala Churna with Madhu was used. 3 to 10 gram Churna was daily applied locally for 20 to 30 minutes on face and nose in the morning. Observation: the effect of treatment on Mukh Pradeshi Krishna Vaivarna Kandu, the number of lesion size of lesion as follows. We can see in the image before and after treatment result, that is symptoms before Mukh Pradeshi Krishna Vaivarna, before and after treatment, that is the Kandu, Varna scale, number of lesions, size lesion, etc. So it is very useful in the management of Venga, that is it is correlated in modern melasmas. Thank you.
Thank you, Dr. Mayush Sandesh Patil. Thank you for the well-explained paper and poster presentation. We know that Amavata, a condition closely related to rheumatoid arthritis, is effectively managed with Ayurvedic drugs that address the root causes of imbalance in the body. Next, I would like to invite Dr. Rahul Singh Rajput for the paper presentation on the topic Role of Ayurvedic Drugs in the Management of Amavata, a case study. Dr. Rahul?
Yes, sir, I'm here.
Good evening, doctor.
Good evening to all of you. Myself, Dr. Rahul Singh Rajput from Chikitsa Department at Dr. D.Y. Patil College of Ayurveda and Research Center. Here I am presenting a paper presentation on role of Ayurvedic drugs in the management of Amvat, a case study under the guidance of Dr. Vandana Bokade ma'am. So we start from role of Ayurvedic drugs in the management of Amvat, a case study. What is Amvat? Amvat is one of the commonest disorder caused by the impairment of Agni, that is digestive fire, formation of Am, that is biotoxins, and vitation of Vados in our body. The Am combines with Vadosh and occupies Shleshmasthan, that is Asti Sandhi, producing features like Angamard, that is body ache, Aruchi, loss of appetite, Alasya, lethargy, Sandhi Ruk means joint pain. Sandhi Shot means joint in, swelling. Amvad is a disease of Madhyam Rogmark, hence it is said to be Krachshatya Yapya. According to clinical features, Amvad very closely resemble with the rheumatoid arthritis. Rheumatoid arthritis is chronic, progressive, autoimmune erythropathy characterized by bilateral symmetrical involvement of joints with some systematic clinical features. Here is a case presentation of a patient, 34 years age, female patient, marriage is married, religion Hindu, education is graduate from Pimpri Pune. She was came at Kajikisa OPD at Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri Pune, with no known case of STN and DM. A female patient of age 34 years visited in Kaichikisa OPD at Dr. D.Y. Patil College of Ayurveda and Research Center with complaints of shul, shoth, and stump in multiple joints since 1 year. History of present illness, as per the patient words, she was normal 1 year back. One day she developed pain in interphalangeal joints bilaterally. After a week, she noticed stiffness in the finger. Later, pain started in the elbow joints. Along with joint pain, she also had a body ache and anorexia. Gradually, pain started in wrist, shoulder, knee, and ankle bilaterally. General examination, severity of the pain started increasing and sometimes associated with the swelling. Later, stiffness in the body during morning hours started. For history of treatment for this patient, took allopathic treatment but got temporary relief. Then she decided to take Ayurvedic treatment. So for further Ayurveda treatment, patient approached to Kaichikisa OPD at DY Patil. History of past illness, as we know, no known case of STN and DM. General examination and Ashtvit Pariksha. As she had 84, temperature was normal. Edema at edema is present at bilateral wrist and ankle joint and knee joint. Clubbing, icterus, and cyanosis was absent. Weight is 57. Bulled moderate. Pallor is absent. Sleep is disturbed. Appetite is also disturbed. अष्टविध नाड़ी परीक्षा में नाड़ी वात कफज, मल इज असम्यक, as we can say विबंध और constipation, मूत्र is सम्यक, जीवा साम, शब्द स्पष्ट, स्पर्श उष्ण, द्रव प्राकृत, आकृति मध्यम. Lab investigation RA factor is positive, that is 25.18 international unit per ml. Drugs which are used in treatment of Amvat is Saman Chikitsa, Veshwanar Chun, Sinhnath Gugul, tablet Gandharva Harit ki, Rasna Saptak Quad. Veshwanar Chun 3 gram twice a day with lukewarm water. Sinhnath Gugul 250 mg, 2 BD with lukewarm water. Gandharva 1 gram, 2 HS at night with lukewarm water after food. Rasna Saptak Kvat 3 teaspoon twice a day with equal water or equal lukewarm water. Panchkarma treatment was done. Ruksha Swedan was given with Valuka Petli Swed at Sarvang. Anuvashan Basti with Brahas Chandavadi Tel 80 ml with alternate Niru Basti, Dashmuradi Char Basti 460 ml. We have given 16 days alternately Anuvasan Basti, Niru Basti, Anuvasan Basti, Niru Basti. Ahar is advice for Ahar and Vihar. As Patyahar and Apatyahar in Amvat. Vihar is here for Amvat. What is observation after treatment and before treatment? Shandisul, before treatment, moderate pain, as we have second grade. After treatment, mild pain is there. Shandhi Stabdata, before treatment is stiffness lasting for 1 to 2 hours. After treatment, stiffness lasting for 6 to 30 minutes. Shandhi Shodh, before treatment, feeling of swelling and heaviness. After treatment, no swelling is there. Sparsh, before treatment, patient winces. After treatment, tenderness without physical response. Angmarth, before treatment, moderate body ache. After treatment, mild body ache. Aruchi, before treatment, unwilling towards some specific ahar but less than normal. After treatment, willing towards all bhojya padarth. Also, here is a grading of alasya, Goravta and Apak before treatment and after treatment. As before treatment is 2, after treatment is 1. Objective RA factor. Objective factor that is RA before treatment is 25, after treatment is 24.36. Discussion. How Amvat will occur in our body. It is due to mainly Ahar, Vihar and Mansik. Ahar, Vihar and Mansik which cause Agniman in our body, and after that Amvish will occupy Samvat is there, Samvat occupies Sleshmistan, Dhamni, and repeated vibration of Amras by all three doses. Srotabishant, after that Amvat Vyadi will occur in our body. Discussion. We have used Vaishvana Chun for improving their Agni. Sihan and Guggulu, it is also used for digestive fire as well as to pacify vitiated vat and cough, and also it decreases swelling in our joints. Gandharva Ritki is a polyherbal Ayurvedic medicine which is used to evacuate bowel and remove toxin from our body. Rasna Saptakvat, it contains Rasna, Amrita, Aragvat, Devdaru, Trikantak, Eran, and Purnandava and Sunti. It acts as an analgesic, and it is also an immunomodulator, anti-inflammatory, and a good appetizer for our body. Ruksha Valuka Potli Svet. Valuka Svet contains Ruksha Ushna Gun which liquefy the dosh and arm, thus increase the blood circulation and decrease the Shandhi Shot and Shandhi Shud instantly. Role of Basti in Amvat is that Basti is considered as the best treatment in balancing Vat dosh. Depending on the combination in the Basti Drav, it has a Shodhan, Shaman, Lekhan, and Brangan effects. So, as we can say, what is the role of Ayurvedic drugs? Role of Vishwanar Chun is in improving digestive power. Guru improves digestive power as well as it decreases the inflammation in our body. Gandharva Haritki, it evacuates bowel movements in our body and removes all toxic materials which are in our body from stool. Rasna Saptakakat, it is an immunomodulator anti-inflammatory, and have a good appetizer property. Baluka potli sweat, which decrease Sandishul as well as Sandishot in our body. Basti is a good Shodhan, Shaman, Lekhan, and Brangan effects. So we used here Basti, Niro Basti, and Sandavadi Basti. Here are the lab reports of the patient. Before treatment, RF factor is 25.18 and after treatment 24.36 in just 16 days with all symptomatic relief from pain, swelling and all. Conclusion is that from this case study, it can be seen that Amvat can be effectively and safely treated by using various Panchkarma procedure and Shaman Chikitsa that is mentioned as Chikitsa Siddhant by Acharya Chakradat. This effect seen in this case and requires more study to substantiate effect of Ayurvedic treatment in Amvat. Thank you to all of you.
Thank you, Dr. Rahul. A well-balanced diet plays a crucial role in maintaining health and preventing disease. Proper dietary practices can enhance immunity, manage chronic conditions, and promote overall well-being. Next, I would like to invite Dr. Rahul Singh Rajput for the poster presentation on the topic Diet Regulations in Health and Disease.
Sir, please share my PDF of poster presentation.
Okay, doctor, just a moment. Please start the session, doctor.
Good evening to all of you. Myself, Dr. Rao Singh Rajput from Kai Chikitsa Department at Dr. D.Y. Patil College of Ayurveda and Research Center. Here I am presenting poster presentation on diet regulation in health as well as in multiple disease under the guidance of Dr. Vandana Bokhare ma'am. Here first is acid peptic disorder. In this, I provide what is to avoid in the disease and what is to reduce and what to be followed in every disease. Here, acid peptic disorder is the first disease, as we can compare with this Agni month as well as Amlapat in Ayurveda. So, what is to avoid in acid peptic disorder is drinking cold water at empty stomach, hotel foods, that is fast food, junk food, maybe cold drinks, bakery items, junk food, and late dinner at night should be avoided in acid peptic disorder. What to be reduced in our day-to-day life? That is coffee, tea, potato input, pickles, papad, chips, deep fried items, spice, sour and oil should be reduced from our daily routine. What to be follow in acid peptic disorder is chew the food well, increase consumption of curry leaves, buttermilk should be advised 2 times in day, green drumstick should be used, carrot, uh, carrot and fiber-rich vegetables should be used in acid peptic disorders. In constipation and piles, non-vegetarian food, that is meat, egg, smoking, alcohol, biscuits, chips, bakery items, spicy food, and hotel food should be avoided in constipations, piles, and fissure patients. What to be reduced in our daily diet? Spicy food, sour food, fried items, pickles, and papad should be avoided or should be reduced. What to be follow? Fiber-rich food should be taken daily. Green curry leaves, coriander, fenugreek seeds, beans, brinjal, onions, radish. Frequent use of buttermilk. water 1 to 2 liters per day, honey plus cold water for bleeding piles, milk and banana should be used for the patients. In hyperlipidemia and heart disease, as well as in fatty liver, what to be avoid? In hyperlipidemia or in fatty liver, ghee, oil fried food, butter, palm, dalda ghee, deep fried items, sweets, that is milk products, ice creams, milk and milk products, mutton, fish, also, meat fish also avoided. In heart disease, hyperlipidemia, fatty liver, it reduces the complications of the disease in future. What to be reduced? Tubers means potato, intake of potato should be reduced from our daily routines. Groundnuts, coconut oil should be reduced, and we have to use sunflower oil. Rice, tea, coffee, and cold drink should be reduced from our daily routine. What to be following these diseases? Sunflower oil, fiber-rich food, garlic, fenugreek seeds, bitter gourd, soybeans, tomato, fruits, green vegetables. Walking is most important in this disease. Walking, yogasana, and dhyan should be used in hypertension and heart disease. What to be avoid is non-veg, that is meat, egg, smoking, alcohol, food with preservatives, pickles, salt should be avoided. What to be reduced? Salt should be reduced from, we have to use sandal salt, oil, fat-rich food should be reduced. What to be follow? Cereals, fruits, fiber-rich greens, vegetable, regular exercise with suitable guidance should be follow. In gut disease, that is Vatrak, protein plus fat-rich food should be avoided. Fried items, pickle, papad, chips, bakery items, smoking and alcohol, black gram, horse gram, groundnut, jaggery should be avoided. What to be reduced is spicy salt and radish potato cabbage should be reduced. What to be follow? 2 to 3 liters of water daily. Green gram, dal, dates and fruits, green drumstick, juice and onion should be follow in our daily diet. In renal disorders, pickles, dry fish, fried items, baking soda, soups, bakery items, tender coconut, nutritional supplement drinks, orange, lemon, sour fruits, fruit juices should be avoided. What to be reduced in our daily diet? Dal, green peas, chana dal, beans, groundnuts, jaggery, pista, badam, ghee, butter, dalda, palm oil, salt in diet per day to 2 gram. It means कि protein intake should be reduced from our daily diet. What to be follow in renal disorders is sunflower oil for cooking. Use vegetables green after soaking them in water for an hour. Fruits like apple, guava, papaya should be follow. Thank you so much to all of you.
Thank you, Doctor. Thank you for the wonderful presentation. Thank you so much, Doctor. Next, we go to the another poster presentation related to the Grihani.
Namaskar everyone. Myself Dr. Omkar Sheke, student of Kai Chikitsa final year from Bhagwan Mahavir Jain Ayurvedic College, Gajendragarh, Karnataka. Thanks to the Pranava team and panel to giving me this opportunity to present a poster. My title for poster presentation is Grahani and Malabsorption Syndrome, addressing the overlooked role of nutrients. So let me start by the definition of Grahani. Grahanya Rogaha Grahani Roga. The disease of organ Grahani is called Grahani. And definition of malabsorption. Malabsorption is a disease of faulty digestion and or faulty absorption. Due to this faulty digestion and faulty absorption, the suffered elements are macronutrients and micronutrients. Generally, in our day-to-day life, we can control nutrients in our diet. Still, we don't choose to out of our indulgent behavior. But when it comes to the disease, we are obligated to act wisely or otherwise health may suffer drastically. As a part of being good physician, treating complex diseases like Grahani requires clear basic principles. First principles of treating Grahani like Roga is fortifying the Grahani by using Dipaniya, Pachaniya, Grahi medicines judiciously. And second one being the topic of my poster, replenishing the dues of Grahani. What do I mean by the dues of the Grahani? So usually when the Grahani is healthy, it produces some goods. What are those goods? The goods, the star bag of that usual chapache is macronutrients, micronutrients, and minerals. In this poster, I'm not going to elaborate therapeutic doses of micronutrients and minerals. Rather, I am shedding a light on their insufficiency in concordance with faulty absorption due to the malabsorption syndrome. If we ignored these nutrients while treating Grahani, the complications are inevitable. The diagnostic of malabsorption syndrome is an amalgamation of clinical suspicion and diagnostic test. The clinical picture, as per Ayurveda, is very beautifully proposed in Samanya Lakshana Shloka of Grahani. But before touching on that, I would like to overview the absorption of nutrients in normal digestion and absorption. As you can see on the right side of this poster, I tried to cram all the process of digestion and absorption in one picture. Basically, there are the three main macronutrients: carbohydrate, fat, and protein. So let's start with the carb. As soon as the carb enter oral cavity, they are broken down by the salivary amylases. The next stops for carb is pancreas. Pancreatic amylase tries to broken down the glucose molecules into monosaccharides. In small intestine, it get absorbed by mucosa with the help of the sodium glucose like transporters, also known as SGLT. Now considering proteins, after ingestion of the proteins are broken down by the pepsin of the gastrin. Then pancreatic protease enzymes do their sophisticated job, and in the end, the small intestine mucosa secretes peptides for absorption of the proteins. The proteins are absorbed in the form of amino acid oligopeptides and last, certainly not the least, the fat, the highest calorie density macronutrient. After ingestion of fats, GI secretion break down the fat molecules, then pancreatic lipase and conjugated bile from the gallbladder acts upon it, and small intestine, chylomicron formation, lymphatic absorption happens. Fat actually requires critical balance of bile acids, gut bacterial flora, intact intrahepatic circulation, good pool of bile food full of bile acid, bile salts, and the proportion of bacteria. The insufficiency of fat, protein, carbs can lead to emaciation, edema. The simple uh, carbohydrate breakdown would produce large amount of gases which may lead to bloating, abdominal pain. As the picture clears it all major absorption of macronutrients happen in small intestines. And basically, along with fat, all fat soluble vitamins A, D, E, and K are also absorbed. Faulty fat absorption leads to the insufficiency of these fat soluble vitamins, which may lead to night blindness, dry skin due to vitamin A deficiency, osteomalacia, hypocalcemia due to vitamin D deficiency, peripheral neuropathy due to vitamin E deficiency, and coagulopathy like petechiae rash due to vitamin K deficiency. Small intestine not only helps to absorb fat soluble vitamins but also helps to absorb water soluble vitamins as well. Folate and B12, aka cobalamin, are very crucial parts of the B complex vitamins. Produces anemia, neuropathy, dermatitis. Basically, B12 is absorbed in the terminal ileum, folate in proximal jejunum. Rest B complex vitamins are also absorbed in small intestine. Moving beyond micronutrients, minerals are also get absorbed throughout the duodenum, jejunum, ileum. As you can see in the picture, all major minerals are being absorbed in small intestines. And their insufficiency majorly produces anemia, skin related problem, bone weaknesses. There's so much to discuss about this all nutrients. But in the constraint of time, I would stop here. The major part of treatment is not only fortifying the grahani, but addressing the nutrient insufficiency. Thank you, panel, for patiently listening. I would like to take a stop. Thank you.
Thank you, Dr. Omgar, for the well explained, detailed presentation. Thank you so much, Doctor. Next, we go to the another presentation. I would like to invite Dr. Himani Samadhan Bangar for the paper presentation on the topic Ayurvedic management of Shida Pitta with respect to Urticaria, a case study.
Good evening, all. Myself, Dr. Himani Bankar, PG Scholar of Kai Chikitsa Department. Today's my topic of presentation of paper is Ayurvedic management of Shita Pitta with respect to Urticaria, a case report under the guidance of Dr. Vandana Bokade ma'am. Shita Pitta is a disease caused when a human being is exposed to cold breath. Due to this, there is the vitiation of Kapha and Vat dosha, which combines to form a Shita Pitta. Here, in the traditional text, there is a clinical features of Shita Pitta, that is Shotha, Kandu, Toda Bahulya, Chardi, Jwara, and vidaha, that is burning sensation. The case is a 41-year-old female patient come to the Dr. D.Y. Patil College of Ayurveda. Patient does not have any known case of STN and DM. Her Hetu Seven is non-vegetarian, excessive intake of spicy and the salty food, and Diva swap. The patient have the signs and symptoms of irregular erythemic patches on the whole body since 6 months, severe itching since 6 months, excessive pain like pricking since 5 months, moderate burning sensation since 5 months, insomnia due to severe itching at night since 4 months. The patient have malamutra samyak with observation of the samjivva. Shabda is prakrut, sparsha is ushna, drika prakrut, akruti is madhyam. Patient is given both shaman and shodhan chikitsa. In shaman chikitsa, we are given kamduda ras 250 mg 2 bd before food with the anupan of lukewarm water for the duration of 21 days. Secondly, Chandraprabhavati is given in the dose of 250 mg 2 bd after food with lukewarm water for the duration of 21 days. Haridra Khanda is given 3 gram TDS after food with lukewarm water 21 days. Panchatikta Ghrita is given 2 teaspoon BD before food with lukewarm water for 21 days. And for the Sthanik local application, Karan's tail is given for the daytime local application for 21 days. This is Shaman Chikitsa. Shodhan Chikitsa is also given to the patient. In Shodhan Chikitsa, Sarvanga Snehan with Chandan Bala Lakshadi Tail is done for the 7 days. Sarvanga Nadi Swedan is done for the 7 days. And Tiktak Shirvasti in the quantity of 280 ml is done for the 7 days. Siraved is done from the cubital fossa on 7th and 21st day of the treatment. Patient is assisted by the criteria that is first swelling as if beaten by the swab. In Ayurveda, we call as a Varti Dansha Sthanang Sopaha. It is graded from 0 to 3 wheels, that is mandalotpatti, how many wheels have appeared during the last 24 hours. Third sign is of itching, that is kandu, it is graded from 0 to 3. Then pricking pain, that is toda, graded from 0 to 3. And the frequency of appearance, that is rog punarbhava, graded from 0 to 3. After the treatment, it is observed that the inflammation like insect bite is 3 or grade is 3 on first day, and it becomes the grade 1 on the 14th day of the treatment. Wills, that is mandal utpatti in the last 24 hours, grade on the first day is 3 and the grade on the 14th day is 1. Pain like pricking is grade on the first day is 2 and grade on 14th day is 0. Severe itching, grade on the first day is 3, grade on the 14th day is 1. Frequency of appearance, grade on first day is 3, grade on 14th day is 1. These are the observations of the patient after treatment. On the slides, before treatment and after treatment pictures are uploaded. Then in discussion, Chandraprabhavati we have given in Sarman Chikitsa as it balances all the 3 doshas, especially the aggravated pitta. It also acts as detoxifying and blood purifier properties. Haridra Khanda is very famous and highly effective Ayurvedic medicine for allergy, as it treated the symptoms of allergy and especially the allergic skin disease like itching skin, etc. It is more potent anti-inflammatory agent. It is also act as a strong antioxidant property that protect all the cell from the oxidative damage. Then Kamduda Ras is used for renowned for its cooling and smoothing properties. It contains ingredient like Muktapishti, Pravalpishti, Shuktapishti, Sankabhasma, Gulaya Sattva, Kapartak Bhasma, which gives the property of cooling and smoothing properties. Panchatikta Ghrita is used for the treatment of non-healing ulcers, skin disease, eczema, worm infestation, hemorrhoids, and cough. Panchatikta Ghrita is also used as a blood purifier for the moderate and the cases of the psoriasis, eliminates the toxins from the body, which is hence we use here for the Shita Pitta. Currant tail, which we have used for the local application, acts as a detoxifying tonic that helps flush out toxins to cleanse and purify the blood. It also controls the itching and burning sensation of skin, which is one of the symptoms of the Shita Pitta. Thank you.
Thank you, doctor. Next, we go to the poster presentation on the topic Ayurveda and mental health.
Good evening, everyone. Myself, Dr. Himani Bankar, PG scholar from DY Patil Ayurveda College. Today's I have made a poster on Ayurveda and mental health. Mental health in Ayurveda is linked with harmony among the three gunas. That is we call as in Ayurveda Sattva, Raja, and Tama. Achieving the balance between the Sattva, Raja, Tama means to achieve the mental health of the person. In Ayurveda, there are many ways for controlling and balancing the mental health of the patient. Among them, one of the treatment is Sattva Chikitsa, that is mind control therapy. It is conducted by focuses on controlling desires and avoiding negative influences to maintain mental equilibrium. Techniques like meditation, mindfulness, and positive affirmations to the strengthen the mind and reduce stress without medication. Sattva Chikitsa is one of the best chikitsa which is told by the acharyas of the Ayurveda for balancing the mental health. Another chikitsa, that is Achar Rasayan, which is also known as behavioral therapy, is mentioned in the Ayurveda. It means that encourages cultivation qualities like truthfulness, calmness, patience, and non-violence. It practices such by behaving such as gratitude, empathy, and regular spiritual activity, which reduces the anxiety and improve the emotional regulations. Uh, Also in Ayurveda, diet and lifestyle for mental balance is specifically mentioned. Nutrients suggested a what specifying diet to combat stress, including warm, nourishing food, herbal teas, and spices like ginger and cinnamon. Regular exercise, yoga, and pranayam help to calm the mind and support mental wellness. Now, the role of Ayurveda in modern mental health, stress reduction. Ayurveda views stress as a Vata imbalance and recommended lifestyle modification, meditation, and herbal appendages like ashwagandha for restoring the balances. It also improves sleeps by some remedies like warm milk with the turmeric, setting a consistent sleep schedule, and using calming oil like lavender promote restful sleeps. Enhancing emotional health techniques like sadrakta for to follow sadrakta help in foster positive emotion and better social relationship, which Ayurveda sees as a vital to the mental health. By improving the all these goals, we can stay balances the mental health of any patient. Thank you.
Thank you, Dr. Himani, for the paper and poster presentation. Thank you so much, doctor. Next is a poster presentation on the topic role of Ayurveda in the management of PCOD, a case study. I would like to invite Dr. Navatke Raghini for the poster presentation. Dr. Raghini, are you there?
Yes, sir, I'm here.
Good evening, doctor.
Good evening, sir. Hello, myself Dr. Raghini Navatke. So today I'm going to present poster presentation on a role of Ayurveda in the management of PCOD, a case study. So, as we all know, PCOD is a complex endocrine disorder which is characterized by the hyperandrogenism, menstrual irregularities, and the polycystic ovarian morphology, which is often associated with the obesity and insulin resistance. So, according to Ayurveda, the PCOD or PCOS is a Vata Pradhan Tridosha Vadi, which is caused by Margavrodha or Dhatukshayajanya Vata Prakop. So the case study, so 27 years old female patient were come to Dr. D.Y. Patil College, OPD, with complaining of irregular menstrual cycles since 1 year, and with also complaining associated complaints of weight gain, mood swings, less blood flow with clots, facial hair growth, and increasing gap between two cycles from last 8 months. So past history was no any major illness, no major illness present. There is no drug history before the patient of having a PCOD, but she has taken the allopathic treatment for last 6 months, but it doesn't satisfy her. So the general examination and systemic examinations were normal. We did the USG of the patient in 2023 November. So it suggests that the bilateral ovarian polycystic disease. So we had patient were given the Shodhan Chikitsa and Shaman Chikitsa. So in Shodhan Chikitsa, we have planned Vaman Karma for the patient. So for the first 3 days, we have given Chitrakadi Vati for the Deepan. For the Snehapan, we have used Triphala Grut for 5 days, from starting at 30 ml and increasing up to 120 ml on the 5th day. So on the 4th and 5th day, patient was able to take only 120 ml of Triphala Grut. So on the 6th day, we have given the Vishram Kal, followed by the Sarvanga Snehan with Sahachar Tel and Bashpasved. On the 7th day, early in the morning, near about 6 to 7 a.m., we have given Vaman Karma to the patient. So patient were having Madhyam Shuddhi, and we have advised Sansarkar Krama accordingly for the 5 days. And in Shamana Chikitsa, we have given Triphala Guggulu 2 BD and Shilajit Vati 2 BD. We have given this for the all the three Shaman Chikitsa we have given for the 3 months after the Shodhan Chikitsa. So Triphala Guggulu and Shilajit Vati we have given after the food, and Chandraprabha Vati and Diblock tablet we have given 2 BD after the food. Before the food, and we have given Kada of 40 ml in the morning and in the evening, which contains Nagarmotha, Avipattikar Churna, Godanti Bhasma, Makshik Bhasma, Ananta, Haritaki, Shankha Bhasma. So all the herbal churna we have given in 4 gram, and all the bhasmas we have given in a pinch of patients having a pinch of it. So the which have the chikitsa were results into. So the patient where undergoes this treatment and results into the she is getting the menstrual cycles normal. The flow of the cycle was very good and without clot and pain. So which is indicating the healthy cycle of the patient. And Shiman Aushadhis were initiated and continued for the 3 months. And after the follow-up, she having good menstrual cycle. Then after the 3 months, we have repeated her USG. So in last February or March, so it's suggestive of normal study. So the discussion we have here, as we all know, PCOD is managed by understanding its pathology by the Doshadusha Samurshana. So in this case, we have done some Prapti Bhanga of the disease, and as the patient having the classical symptoms like obesity and hormonal imbalances. So according to that, we have considered this as a margavarodhajanya vatakava pradhana Vadi. So by Shodhan Chikitsa, like Vaman, is beneficial for the Strota Avarodha and like Strota Shodhana of the patient. And while the Saman Chikitsa enhances her metabolic activity, stimulate the Agni, and improves the Rasadhatu. As Rasadhatu, as we all know, Rasadhatu get had Ras Dhatu is become more clear, the Raja quality also increases. Thus, Shaman Chikitsa like Chandraprabhavati, Shilajitavati, and the bhasmas like Makshik Bhasma, Shankha Bhasma, Vanga Bhasma, etc. are helps to regulate the menstrual cycle by pacifying the vitiated Vata dosha and balances the hormones of the uh, pituitary gland and the ovaries. As we all know, Diablock tablet we give in the Madhumeha patients, but here we have given for the resistance of the patient having insulin resistance. So we used Diablock tablet here. So the conclusion, uh, as we know, these Ayurvedic medicines and the Panchakarma is very effective in Rajastrava, that is PCOD. So utilizing this Ayurveda treatment, the patient was treating successfully. So thank you.
Thank you, Doctor. Thank you for the well explained paper and poster presentation. Thank you so much, Doctor.
Yes, sir. Thank you, sir.
Next, we go to the paper presentation. We know that gridresi, commonly referred to as sciatica in modern medicine, causes severe pain along with sciatic nerve. Next, I would like to invite Dr. Madhavi Estarne for the paper presentation on the topic Ayurvedic management of gridresi with respect to sciatica, a case report.
Good evening, everyone. Myself, Dr. Madhvi Dharme, PG second year scholar, Kai Chikitsa department. So the topic of my presentation is Ayurvedic management of gridresi with special reference to sciatica, a case report under the guidance of Dr. Vandana Bokade ma'am. So introduction, gridresi commonly known as sciatica typically manifests as lower back pain radiating down to the thigh, calf region and eventually to the foot. It presents with pain that travels along the path of sciatic nerve, accompanied by sensation of tingling, numbness, stiffness and a pricking feeling. This condition predominantly affects individuals in the middle to elderly age group. The condition is specially marked by pain resulting from pathology affecting the sciatica nerve or its originating nerve roots, typically stemming from the L4 through S2 nerve roots, which converge to form the sciatic nerve as it exits the pelvis. Next slide. Gridresi is divided into two types depending upon the involvement of dosha, that is Vataj and Vatkafaj. The signs and symptoms of Keval Vataj Gridresi are pain, pricking sensation, twitching in buttock, low back pain, and stiffness. The Vatkafaj Gridresi is associated with symptoms of heaviness, anorexia, and drowsiness. Katu and Ruksha Ahar and atisnigdahar, improper sleep, physical exertion, riding, lifting of heavy object, and awful physical conduct, etc., mainly considered as hetu of disease. Ayurveda categorizes gridresi as a vata disorder for which it advocates both Shodhan karma and shaman chikitsa as therapeutic approach. Shaman chikitsa involves internal medication while Shodhan karma employs purification methods such as basti chikitsa. This case reports underscore the significant contribution of Ayurveda in effectively managing sciatica through its holistic treatment modalities. So the chief complaints of patient was low back pain radiating to bilateral lower limb, stiffness in calf region and thigh muscle. It is more in left leg than right, heaviness in bilateral lower limb, difficulty in walking. All the complaints are since 2 years, which is aggravated since 2 months. Next slide. History of past illness was fall while walking 4 years back. Known case of hypertension since 6 years. He was on medication of a tablet amlo 2.5 mg OD. No history of illness such as DM, thyroid dysfunction. Next slide. Personal history was appetite mildly reduced, thirst was normal, bowel was unsatisfactory, urination normal, sleep disturbed due to pain, diet vegetarian, dominance of dravya in diet shak, dahi evam lagu ahar, dominance of rasa in diet was kashay ras, व्यसन addiction was tea 1 cup thrice in a day. Vyayam doing sieving since 40 years, Nidra 6 to 7 hours per night. Next slide, general examination. Build was moderate, nourishment was moderate, temperature febrile,
pallor, icterus, cyanosis was absent, lymphadenopathy absent, edema absent. Pulse rate was 78 per minute, BP was 130 by 80 mm per Hg, respiratory rate 18 per minute, weight 64 kg and height 155 centimeter. Next slide. Ashtavid Parikshan. Nadi was Vat Kafach and Sarpagati. Mala was Asantushta, that is 2 to 3 times per day. Mutra Pravrutti was Samyak, but frequency was increased. It was 4 to 5 times per day. जिव्हा साम शब्द प्राकृत स्पर्श समशीतोष्ण द्रिक सामान्य आकृती मध्यम. Next slide. Musculoskeletal examination. Gait limping with support. Doorbell test was positive at L4 and L5. MRI findings was sacralization of L5 vertebral body, L4 L5 disc, reduced disc height, diffuse central and bilateral paracentral posterior disc bulge noted, compromising neutral foramina, indenting thecal sac with compression over bilateral existing L4 nerve roots. Next slide. Lower limb examination. SLR test was positive in left leg at 30 degree and in right 35 degree. Bragard's test, femoral nerve stress test, Faber's stress, all were positive in both the legs. Coin test was possible with pain in both the legs. Heel walk was not possible in both the legs, and toe walk was possible with pain in both the legs. Next slide. Roga Parikshas, that is Samprapti Ghatak Hetu. Long hours of sieving since 40 years. Dosha Vat Kafaj. Dusha in Dhatu Rasa Asthi Mansa and Majja. Strotas and Strotu Dushti type. Sanga Vimarga Gamana. Agni Jatharagni Mandya. Udbhav Sthana Pakvashe. Adhishtan Kati Spika Uru. संचार स्थान कटी स्पीक व्यक्ति स्थान स्नायु सिरा क्रियाकाल व्यक्तावस्था रोग मार्ग आभ्यंतर व्याधि स्वरूप चीरकार्य. Next slide is of treatment protocol. कोष्ठ शोधन with गंधर्व हस्तादि एरंड तेल 60 ml along with sunthi gel 60 ml. Total Vegas was 7. Sarvanga Dashmul Parishik followed by Nadi Sweda for 7 days. Katibasti with महाविष गर्भ तेल for 7 days. शोधन अनुवासन बस्ती with धन्वंतरी तेल 70 ml. निरुह बस्ती with दशमूल निरुह plus कल्क. शतपुष्पा गुडुची and यष्टि मधु. शमन रासना सप्तक कषाय 50 ml. बीडी टैबलेट त्रयोदशांग गुड़ 2 tablets बीडी. टैबलेट शल्य की MR 1 tablet बीडी. कैप्सूल धन्वंतरम 101 1 tablet बीडी. Next slide. Result. Following the completion of the comprehensive 7-day Ayurvedic treatment protocol, the patient experienced significant improvement in lumbar pain, reducing in heaviness and increased range of motion in the spine. Additionally, there was noticeable enhancement in gait. The patient reported complete relief from symptoms. Evaluation of the patient progress was conducted using specific subjective and objective criteria, with no post-therapy radiological investigation performed. Subjective was patient's complaint pain in low back region radiating to bilateral lower limb has significantly reduced. Heaviness and stiffness in bilateral lower limb was reduced. Patient is able to walk without support. Tenderness over L4, L5 reduced. Objectives were gait improved. Doorbell test was negative. SLRT Bragard's femoral nerve stretch test, Faber's test, all were negative in both the limbs. Coin test, heel walk and toe walk was possible in both the limbs. Discussion. The treatment protocol was formulated on the basis of the principle of Acharya Charaka and also as mentioned in Bhel Sahita for treatment of Gridrasi. Treatment plan was adopted by the Lakshanas and Dosha predominance. On first day, Koshta Shodhan Mrudu Virechan with Gandharva Hastadi Eranda Tel was adopted for Vatanuloman for getting rid of Ama Avastha and Kapha predominance. Shunti Siddhajal was given along with it. Svedana act as Stambhagna Gauragna also as Ushna in nature. It performs Stroto Shuddhi and Am Pachana which relieves Stambha. It results in dissolution of Kapha, that is Strotosu Vilayanam, softens the channel allowing Vata to flow regularly. Dashamul for Parishik mainly used for Vatagna and Kapha Shaman property, which also has impact on Rasa, Mansa and Asti Dhatu along with analgesic and antispasmodic effect.
Local snigdha swedan through kati basti is hot fermentation which reduces muscle spasm and induce vasodilation, promoting blood flow, which helps the drug to reach the target organ. Thank you.
Thank you, doctor. Next, we go to the poster presentation on the topic Padya Padya according to season.
So the topic of my poster presentation is Patya Apatya according to season. Introduction. The Ahar Vihar, which is beneficial and nutritional to the body and also gives the happiness to the mind, is known as Patyam, and opposite to that is known as Apatya. Patya means belonging to way, suitable, fit, proper, and wholesome. Aim of this poster is review of Patya Apatya according to the Riticharya, that is season. Objectives to study Patya Apatya according to the season. So first of all, Vasanta Rutucharya. Patya in Vasanta Rutu are take old barley, wheat, and flesh cooked by holding in arrow added with honey. Can also take mango juice. We can take alcoholic preparation like asav, arishta, sidhu. Take bath anointment with powders of camphor, sandalwood, etc. Aggravated kapha should be expelled by administrating drastic emesis and nasal medication. Apatya in Vasant Rutus are avoid heavy cold, unctuous, sour and sweet diet. Avoid sleep during daytime. Next is Grishma Rutu. So Pathya in Grishma Rutus are take sweet, cold, unctuous and liquid food. Take cold churn preparation with sugar, flesh of terrestrial animals, ghee, milk and rice. One can also drink mango juice and churn curd added with pepper. Cold water made up with fragrant materials. Drink milk mixed with sugar candy at night. Rest in cold home in noon under soothing moon rays at night. Apply paste of sandalwood to body. Rest in garden and on bank of reservoir. Apatya in Grishma Rutus are alcoholic preparation should be avoided. Avoid salt, sour and pungent food. Avoid excessive exercise. And one should avoid excessive sexual activity. Varsha Rutu Pathya are drink medicated water and rice with honey. Take sour, salt, sweet and untouched food to combat vata. Old barley, wheat, rice prepared with meat soup, dal soup are beneficial. Small quantity of alcoholic preparation with honey is allowed. Medicated enema should be given after cleansing with emesis and purgation. Avoid day sleep, excessive exercise, hot sun and sex in Varsha Rutu. Pathya in Sharad Rutus are take food rich in sweet, bitter, and astringent taste, light in quantity, which will pacify Pitta dosha. Take rice, barley, and wheat. Water purified by sun rays in day and moon rays at night should be taken. This is called Hansodaka. Clean clothes and garlands made up of seasonal flowers should be worn. Variation should be administered to expel morbid Pitta. Bloodletting too is preferred. Avoid fat, oil, meat of marshy and aquatic animals, alkali, curd, day sleep. Missed day sleep should be avoided in Sharad Rutu. In Hemant Rutu, Pathya, take flesh of water animals, carnivorous animals, and animals residing in burrow with sweet. Take sidhu milk, sugarcane juice, and its product. Take body and head massage, hot water bath, application of anointment made up of kumkuma and kasturi, fumigation with aguru, light and warm clothing, exposure to morning sunrays, sedation and living in room heated with heaters. Apatya in Hemant Rutus are avoid food and drink which are light and are liable to vitiate vata. One should not expose to cold waves. Underfeeding and intake of gruel are also to be avoided. Shishir in Shishir Rutu, Patya and Apatya are as similar as Hemant Rutu. So the observation are Ayurveda has holistic and scientific approach in health management. It emphasizes much more on diet and regimen along with medicine. The diet and regimen
which is beneficial to the body and gives the happiness to the mind, is known as Patya, and opposite to that is known as Apatya. Most of the health problems develop due to the faulty eating habits and regime. Ayurveda deals with the Patya Vyavastha, planning of dietary in a very specific way. Conclusion. Hence, it can be concluded that Patya have significant importance in Rutucharya. Thank you.
Thank you, Dr. Madhavi, for the well-explained paper and poster presentation. Thank you, Doctor. We know that Shitra, known as vitiligo in modern times, is a skin condition marked by depigmentation. Next, I would like to invite Dr. Vishal Gupta for the paper presentation on the topic Ayurvedic Management of Shitra, a case study. Dr. Vishal, are you there?
Yes, I'm there.
Good evening, Doctor.
Good evening. Good evening to all respected panel members. Is my screen share available?
Okay, Doctor, I will share for you. Just a moment, Doctor.
Okay.
And please start the session, Doctor.
Yes. I'm Dr. Vishal Gupta, second year PG scholar in Amavata department from Dr. D.Y. Patil College of Ayurveda, Pune, and under guidance of Dr. Ravindra Rajpal. Today, my topic is the case study on Shvitra vitiligo. Next slide, please. The word Shvitra suggests that it is derived from Sanskrit Shveta, which means white patch. According to Kashyap Sahitra, the Shvitra is described as Shveta Bhava Michanti Shvitram. The Bhajak pith, which is situated in the skin, is responsible for Chayan Prabha of the Twacha. Any impairment in the Bhajak pith and Vata along causes skin disease like Shvitra. In Shvitra, morbidity is located in Medu Dhatu. It is also called as Kilasa Darun Arunan Shveta Pushta. According to modern aspect, the Shvitra can be manifested with vitiligo. Vitiligo is an acquired condition affecting 1% of the population worldwide. Focal loss of melanocytes results in the development of patches of hypopigmentation. It is thought to be the result of cell-mediated autoimmune destruction of melanocytes. So, segmental vitiligo is restricted to one part of the body only, but not necessarily a dermatome. The patches of depigmentation are sharply defined in vitiligo. The objective of the study is to determine the efficacy of Ayurvedic treatment in Shvitra as mentioned in classical Ayurvedic treatises. The patient that is presented over here is a 12-year-old male, not a known case of hypertension or diabetes mellitus. Came with the complaints of discolored patches over left-sided cheek, expanding over lips and ears between ears, associated with mild itching with no burning sensation since 6 months, began in December 2023. All these symptoms said to have aggravated gradually, that is in the month of June 2023. Subject initially neglected the symptoms and did not take any medicines. As we can see in these pictures, the patches started spreading gradually over the width region of the left cheek unilaterally. Hence, he consulted later at Dr. D.Y. Patil College of Ayurveda in July 2024. The personal history of the patient that he is a student, unmarried, Hindu. The diet of the patient is mixed, predominantly non-veg, having twice weekly. The appetite is normal, bowel 1 times per day, micturition 3 to 4 times per day. He takes sleep 6 to 8 hours at night and day sleep of 1 to 2 hours. There are no known allergies and no addictions, and no major past histories involved with skin complaints before 1 year or any trauma history. The Nidan that came out of history is Aharaj Nidan, Viruddha Har Masya Vidugdha, Vishmashan, intake of water after exposure to sun, intake of mass, Kulatta, Takra, Masya and Mulika more frequently, and Adhyashana. Vihara Nidan to be known are Divaswapna, exposure to sun for long hours while playing, Shitvat Sevan, playing in mud for longer duration daily. The clinical findings in this patient came with Site of lesion over left side of cheek beside lips up to expanding up to ear. Lesions were epidermal, distribution was asymmetrical, character of lesion was macular. Number of lesions on left side was 7 to be counted. Right side there were no lesions. The size of major lesion on the left side of cheek was 5 by 2.5 centimeter and along with 1 by 1 centimeter lesions. Color of the patch was white, arrangement non-segmental, itching was mildly present, discharge was absent. Superficial sensation on the lesions like pain, swelling, and paresthesia were absent. The Samprapti Ghatakas evaluated are to be as Dosha Tridosh, Dusha, Rasa Rakta Mas and Meda, Ama, Jatragni Janya Ama, Agni, Jatragni Mandya, Dhatwagni Mandya. Srotas included are Rasava, Raktava, Masava, and Medova. Srotodoshti Prakar is Sanga, Rogmarg Bhaya, Udbhav Sthan is in Amashe, Vyakt Sthan is Tvacha, Rog Swabhav is Chirkari, Sadhya Asadhyata is Yapya. The subjective criteria: patient was observed for improvement in hypopigmented patches, itching, and improvement in general condition. Objective criteria was seen as improvement calculated on scale measurement in centimeter of the hypopigmented area. Treatment plan was made with Shaman Chikitsa and Shodhan Chikitsa, including Am Pachan, Snehapan, Abhyanga, and Swedana, Virechana. When first patient came to OPD on 8 July 2024, the Shaman treatment was started with Arogyavardhini Vati, Gandhak Rasayan, Mahamishadi Kada, Haridrakhand with Bakuchi Churna, and Leucoma ointment. Later, the patient came to follow up on 16th August. The patches over the whitish discoloration turned to pinkish from white. The treatment was mildly changed from Arogyavardhini Vati to Panchatikta growth and rest same. On 5th September, the patient came to follow up. Dark patches of skin seen in the center of the depigmentation area turned to be a skin color, normal. The treatment, the Shodhan treatment was planned further. From 12th September to 14th September, Chitrakadi Vati was given for Agni Dipan and Pachan. From 15th September to 19th September, Panchatikta Grit was given for Abhyanta Snehapan in increasing quantity. From 20th September to 21st September, Sarvanga Snehan as Abhyanga and Sarvanga Svedan was given to the patient. On 23rd September, Virichan was given to the patient with Trivrata Avleha. From 24th September, Sansajan Kram was started for once a week, for whole week. The patient came to follow up later on 24th October. Depigmentation was cleared out. The dark patch of skin expanding to the depigmentation was seen. Treatment was continued with Panchatikta Grit, Gandhak Rasayan, Mamashtadi Kada, Haridra Khand Churna, leucoskin syrup, and leucoskin ointment. Later, the patient came on 28 November. The treatment was modified mildly with Haridra Khand Churna, Manjishta Churna, Sariva Churna, and Bakuchi Churna, each 500 mg. Results: the improvement was observed in the subjective criteria with 60 to 65% filling of hypopigmented patches with normal skin density in left cheek region. Number of patches reduced from 7 to 4. Color was hypopigmented area color was seen improving. Itching was reduced completely, as we can see in the pics. The hypopigmentation areas were reduced significantly. Discussion: Shvitra can be managed very well in Ayurveda by both Shodhan and Shaman Aushadhis if treatment can be initiated in early stages. We can observe satisfactory results. In this case, patient presents with whitish discolored patches on left cheek region after 20 days of Shaman Aushadhis with patches turned to pinkish. Gradual filling of depigmented area with normal skin density enhanced after first round of Shodhan itself. Dark pigmentation over prior whitish patches with 60 to 65% filling was observed. The herbs and cults included like Bakuchi Churna have antioxidant properties, stimulate melanocytes for melanin synthesis, and has immunomodulatory effect. Gandhak Rasayan, the main ingredient Gandhak sulfur, has several potential uses for skin. It is Rakta Shodhak, Tvacha, and Kushtagna. Arogyavardhini Vati is having Rakta Drishtihara, Pushtahara, Doshahar properties of Pitta, and improve digestion and metabolic activities. Panchatikta Grit has Totahar property which helps provide relief from itching and irritation caused due to psoriasis. Its Pitta balancing and signal properties help to control tiredness, which is also beneficial in psoriasis. The conclusion of all this is the incidence of vitiligo is increasing due to faulty lifestyle. So, identifying and eliminating multifactorial agents associated with the diseases based on Ayurvedic principles is essential. Shodhan, along with Shaman Chikitsa, help to remove the root cause of the disease and prevents the recurrence of the disease by eliminating aggravated doshas in the body through resulting overall improvement with respect to number of lesions, size of lesions, regaining of normal skin pigmentation. The references were taken. Thank you.
Thank you, doctor. Next, we go to the neonatal cholestasis related poster presentation.
Can you please present my poster?
Sure, doctor. Hello, Dr. Vishal, can you hear me?
Yes, sir.
Doctor, please start the session, doctor.
Yeah. Today I'm going to review the condition neonatal cholestasis that is related with Rutuja Kamla in Ayurveda. So the neonatal cholestasis, as the word suggests, chole means bile and stasis is accumulation. Accumulation of bile in neonates apart from physiological condition. If the total serum bilirubin in first scenario is less than 5 mg per dl and conjugated bilirubin is more than 1 mg per dl. Second scenario can be that if the total serum bilirubin is more than 5 mg per dl and conjugated bilirubin is more than or equal to 20% of the total serum bilirubin, or else if the baby is having jaundice persistently for more than 14 days. Further, etiology can be understood by two major factors as intrahepatic and extrahepatic. Intrahepatic causes could be hepatobiliary infection, inherited or metabolic disorders, ductal anomaly, endocrine disorders, prematurity of liver, certain drugs, ischemia, parenteral nutrition, or sepsis. Apart from intrahepatic, extrahepatic causes could be biliary atresia, choledochal cyst, tumors, cholelithiasis. The signs and symptoms could be best understood with Lakshana of Rudrapat Kamla, like Haridra Netra, Mutra, Tvak, Shvetavachastada, Nara, Ato, Pishtamba, Guru Hruday, Dorbalyata, Alpagni, Hikka, Shwasa, Ruchi, Jwar, recommending Pitta Shaka Ashrit. So, how we differentiate the jaundice from physiological to cholestasis in a neonate? Once jaundice is developed, total serum bilirubin is traced to be more than 2 mg per dl. When conjugated serum bilirubin is more than 20% and urine is highly colored, the diaper is getting stained, and the color of the stool is either clay or normal, we can diagnose it as a cholestasis, further evaluating the etiology of intrahepatic or extrahepatic. Investigations that confirm the diagnosis are LFT, that is increase in conjugate bilirubin, cholestasis marker like 5-nucleotidase alkaline phosphatase, normal value of GGT, that is gamma glutamate transferase, is 40 units per liter. Raised value of GGT gives us a clue to the cause of neonatal cholestasis. That is 4 times the elevation in GGT is suspected with intrahepatic cause, 10 times the elevation in GGT suspected with extrahepatic cause. Triangular cord signs comes positive in the ultrasound in this patient. Best investigation out of all is liver biopsy. The medical management is to treat the primary cause, then support other clinical impairments like MCT oil supplementation for malabsorption of dietary long chain triglycerides, multivitamin supplementations like vitamin A, D, E, K for fat soluble vitamin malabsorption, micronutrient supplementation like calcium and zinc. The surgical management includes anatomical corrections, Kasai procedure, that is temporary hepatico-jejunostomy. Definite management is liver transplantation. Thank you, doctor.
Thank you, Dr. Vishal, for the well-explained paper and poster presentation. Thank you so much, Doctor. Next, we go to the another presentation. I would like to invite Dr. Bhumika Jain for the paper presentation on the topic Ayurvedic management of Dadru with respect to Tinea corporis, a case study.
Good evening.
Good evening, Doctor.
Am I audible?
Yes, Doctor, you're audible.
Can you share my presentation, PPT?
Okay, Doctor, just a moment. Doctor, please start the session, Doctor.
Yes. Good evening, everyone present here, all the panel members. Good evening. Myself, Dr. Bhumika Jain. I'm second year PG scholar from the Department of Kaya Chikitsa, Dr. D.Y. Patil College. The title of my today's presentation is Ayurvedic Management of Dadru with respect to Tinea corporis. It's a case study which is done under the guidance of Dr. Dipankar sir. Abstract, this while studying, there was a Dadru was found out to be more similar to Tinea corporis, like signs and symptoms. In this case, a 65-year-old male patient having erythematous patch on his right leg came to our OPD. And by treatment regimen, the patch was reduced to like 7 centimeter was reduced to 2 centimeter after 30 days of treatment approximately. Along with subjective parameters, we noted the observation. Okay, next slide. Introduction. Uh, According to Ayurveda, every skin disease is classified broadly under Kushta Vyadhi. Sushrut has mentioned Dadru in Mahakushta, and Charka has considered Dadru under Shudra Kushta, and accordingly, shloks and references are given. Next slide, please. According to modern, Tinea corporis is majorly a fungal skin infection which is caused by dermatophytes, and it's characterized by itchiness, redness, and mainly they are present on neck, skin of neck, trunk, and extremities. So all these symptoms are basically correlated somewhere to the Dadru symptoms. Hence, we can correlate Dadru with Tinea corporis. Next slide, please. Uh, in this case, a 65-year-old male having a erythematous patch on his right leg came to our OPD with severe itchiness, burning sensation, constipation, which was aggravated from 2 months. While taking a detailed history, there was find out that patient was not hypertensive or had no any history of comorbidities. He was on allopathic medications like for antifungals he used, but he got unsatisfactory result since past 2 months, and he visited our OPD, and the hetu were find out to be kaphavardhak ahar. There were mithya ahar, drava snigdha ahar were consumed by the patient. Next, please. Then we examined Ashtavida Pariksha, and there was find out that Mala was constipated, Mutra was found out to be Prabhutal, Jivha was Sam, Shabda Sparsha were normal, Druka was Prakrut, and weight was 65, which is Madhyam category. According to Dashavida Pariksha, the Prakruti was found out to be Vata Kapha, Vikruti was of Kapha Pradhana Rakta Triroshaj, and everything rest is Vaya was Madhyam, Sarata was Heen, Samhanan was Heen, Sattva was found out to be Heen, Satmya was Madhyam, Ahar Shakti and Jaran Shakti were Madhyam, and Agni was Visham. The patient was observed on subjective parameters. Mostly the subjective parameters include Kandu, itching, Raga, that is erythema, Pidika, that is eruption, Daha, burning sensation, and Rukshita, dryness. All these were given grade from 0 to 3 as per severity. Daha and Raga was according to skin color, Pidika was according to number, Daha and Rukshita was again according to severity. The line of treatment was planned as per Nidana Parivarjan, then Am Pachan was thought, then Tridosha Shaman, Rakta Shodhan, Pathya Palan, and Yoga Pranayam was given. Treatment plan which was used was Nimbadi Kwat, which contained Nimba, Khadir, Sariva, Manjishtha, Daru Haridra, Churna. Each 5 gram churna was taken, and patient was asked to prepare a decoction of 40 ml, which was to be consumed twice a day, that is morning and evening, empty stomach, 7 a.m., 7 p.m., along with lukewarm water for 1 month. Along with that, internal medications Rakta Shodhak Vati, Gandak Rasayan were given 250 mg each, 2 tablets twice a day, morning, evening, along with lukewarm water for 1 month, and Eranda Tel was given 10 ml after food at bedtime for 1 month. The mode of action of these drugs can is like Nimba is effective on all skin vikar. It is Sheetag, Lagu, and Grahi. Hence, it is Krumigna, Kapha, Pitta, her properties are there. Khadir was used because it is Shrestha Kushtagna Dravya, and it has Tikta Kashai Ras in it, which helps in the treatment of Dadru. Sariva was taken because of the burning sensation, which relieves burning sensation, and it also acts on Kapha Pitta Hara. Then the Daru Haridra is best Kandugna Dravya, so it relieves itching, and it also has anti-inflammatory, antioxidant properties. Manjishta was taken because it has a Rakta Shodhak properties, and it also has antimicrobial and antioxidant properties. Next. Rakta Shodhakvati, along with Kapha, Rakta was also involved, dosha. So, thinking that we took the Rakta Shodhakvati, it improves digestion also, and it purifies blood and has anti inflammatory action. Gandhak Rasayan, it has Gandhak main ingredient in it, so it acts as Agni Deepak also, Ampachak, Krumi Nashak, and it's also Varnya, so it helps in all kind of skin disorders. And Erandatil was given as an anuloman, which acts as laxative. The signs and symptoms were observed on the first day when they were accessed. So the Kandu was reduced from grade 3 to grade 1. Raga was reduced from grade 3 to grade 1. Daha was reduced from grade 2 to grade 1. Pidaka was almost gone. Rukshita was from grade 2 to grade 1. These are the results of before and after the treatment. And while Shaman Chikitsa was given, there was also a session of Rakta Mokshan after 10 days in between, which were along because of the kapha and rakta dosha involvement. In this case, significant symptomatic relief was observed, and all the signs patient was all in signs and symptoms free, and he was able to do all his activities. So we can conclude that Shaman Chikitsa, along with Nidana Parivarjan, proper diet following, and Rakta Mokshan, we can give patient a remarkable symptomatic relief in the features of Dadru, and it needs to be studied in more patients, of course. These are the references from which it was taken. Thank you.
Thank you, doctor. Next, we go to the poster presentation related to the Amavata.
Can you share that, please?
Okay, doctor, just a moment.
Yes. Okay. So the topic of the poster presentation is Amavata rheumatoid arthritis, a case study. It is also a case study. So as we know, Amavata is one of the most painful musculoskeletal disorder, and in this case, a patient was given Ayurvedic internal medication along with Panchakarma therapy for 30 days, and symptoms were assessed on subjective and objective parameters. The patient description was a female patient of 61-year age. She had difficulty, she has relapsing pain and constant side effects of modern medication. So she visited Ayurvedic OPD for Ayurvedic treatment. On examination, her blood pressure was found out to be 130 by 80, and pulse rate was 80. Then the signs and symptoms were, can you just slide down this poster? Complaints. Uh, More, yeah. So she had knee joint and ankle joint pain along with stiffness and swelling, and bilateral hand phalangeal joint stiffness was there, as you can see in the picture. There was difficulty in walking, generalized weakness was present, loss of appetite, and patient had all these complaints since 5 years. The blood investigation which were suggested were CBC ESR, and Pathya was given to her. Along with that, musculoskeletal examination was done, which was Ruber, Caller. Can you just yeah. Musculoskeletal examination was done on inspection and palpation. We saw a difficulty in walkness. There were signs of inflammation was also present on knee joint, ankle joint, and phalangeal joint, which were grade 3. Ruber, Caller, tumor, everything was there. And in history, there was hypertension since 10 years, and rheumatoid arthritis since 5 years. She was on medication amlodipine 5 mg OD, and diagnosis was done. On the basis of this diagnosis was done Amvata, and treatment plan included Sihanath Gugulvati 250 mg 2 BD, which had Ampachak, Vatanuloman, and Lekhan action. Mahavata Vidvamsa Rasa, which had 125 mg 2 tablets BD were given, which had a Shulagna effect, and a decoction was given, which included Haritaki, Rasna, Devdar, Bala, Erandamul, each 5 gram. 40 ml decoction was asked to be prepared for 2 times a day. It had Vata Shamak, Shulagna, and Rasayan properties. Then Erandatel was given at night 10 ml for Vatanuloman and Ampachak. Along with that, a Shodhan Chikitsa was also advised, that is, Panchakarma was advised to her, that is, Sarvanga Valuka Potali Swed was given, along with Matra Basti and Vetran Basti alternately. Matra Basti was given with Balatel 80 ml. So, observations was made mid progress was there after 15 days. The Symptoms such as pain, swelling, spasm were reduced from grade 3 to grade 2. Difficulty in walking was reduced from grade 3 to grade 2. Lethargy was reduced from grade 2 to grade 1. Generalized weakness subsided from grade 2 to grade 1. Constipation decreased to grade 3 to grade 1, and appetite was improved. After endpoint, after the complete session, she got 70% relief from the symptoms of Amavata. And before and after the treatment, we have the values of CBC and ESR, which we can see HB was improved from 9.3 to 10.6. Total leukocyte count was 6,600 to 5,800. Platelet count was 3 lakh 82 to 3 lakh 96, and ESR was reduced to 28 to 19. Conclusion: significant improvement in patient signs and symptoms was observed, along with significant decrease in values of ESR. So we can conclude that the management of Amavata through Ayurvedic drugs along with Panchakarma therapy show better and faster symptomatic improvements with lesser side effects of allopathic drugs. So including Panchakarma therapy in our Ayurvedic management is gives us more scope to give our patients a symptomatic relief. Thank you.
Thank you, Dr. Rutuja. Thank you for the presentation. Next, we go to the another paper presentation. I would like to invite Dr. Radhika Singh for the paper presentation.
Introduction. Good evening to all. Myself, Dr. Ratika Singh Badoria. Today, I am going to present the topic, the role of yoga and pranayam in promoting wellness during pregnancy. Introduction. Ayurveda, a traditional medical practice that treats the body, mind, spirit, and complements yoga for human growth. Impact of pregnancy. Pregnancy and delivery affect both physical health and mental well-being, draining energy and causing significant life changes. Yoga before conception. Women should start practicing yoga before conception to improve overall health and ensure the well-being of future generation. Yoga, a spiritual science focused on self-realization and self-development, helping individuals reach their full potential in life. Purpose of yogasanas. These postures are designed to reduce risk, prevent complication, and promote a healthy pregnancy and delivery. Guidance. Yogasanas can be practiced throughout pregnancy under the supervision of a qualified yoga teacher for safe and effective results. During first trimester, this is the important period of brain development, that is neural tube formation occurs in fetus. Period for ill health, that is nausea, vomiting, giddiness, urinary complaints, etc. Unfortunately, most of the pregnant ladies never approach a gynecologist till the end of 4th or 5th month. Complication in the form of blighted ovum, miscarriage do occur in this period. During second trimester, the period for feeling of sense of life growing inside her womb. Active movements of her future delivering child is felt in the form of a fine kicks. Unseen bonding between mother and child begins here. Period for successful completion of organogenesis. Period for trouble in the form of backache, mild pedal edema, varicose veins, etc. Period for beginning of pregnancy induce complications like hypertension, diabetes, thyroid abnormalities. During third trimester, period for complication of growth and development of the fetus, period for placental maturation, period for feeling of exhaustion, breathlessness, pain and heaviness of the abdomen, etc. Period for complication in the form of early onset of labor, placental abruption due to hypertension, reduced fetal movements, intrauterine fetal death, etc. My aim of the study is to review the effect of yoga and pranayam in pregnancy. And the objective is to study the efficacy of yoga on pregnancy. Material and methods. That data was collected by searching the literature in the form of articles and scientific journals on the databases like Google Scholar and PubMed. All relevant data regarding yoga and pranayam in pregnancy. Here are some effective yoga poses which can be practiced during the pregnancy in different trimesters. Tadasan, Rukasan, Trikonasan, Veerbhadrasan, Parsh, Konasan, Kati Chakra Asan, Parsh Uttanasan, Siddhasana, Swastikasana, Vajra Asana, Veerasana, Gomukasana, Dandasana, Paschimuttanasana, Janu Sheesh Asana, Upavishtakon Asana. Then Paduttan Asana, Adhomukh Shwa Asana, Chaturang Dand Asana, Uttanasana, Makra Asana, Shav Asana. Now we will lead to pranayam and its benefit. Pranayam, essential for expectant mothers alongside asanas to promote physical and mental health for both mother and fetus. Luminaries, figures like Vyas Maharishi and Ashtavakra achieve intellectual and spiritual growth while in the womb. Purpose of pranayam involves breath control to channel energy, enhancing awareness and intellectual clarity. Mental clarity. Pranayam helps clearing the mind of negative thoughts, leading to spiritual and intellectual elevation. Pregnancy practice. Pranayam should be practiced throughout pregnancy. Best poses, Swastik Asana and Veer Asana are ideal for breathing exercise during pregnancy. Pranayam benefits. Generates vital energy, aerates the lungs, supplies plentiful oxygen, increases endurance, steadies the wandering mind. In utero, oxygen is delivered through the umbilical cord. Mother with adequate oxygenation can always nourish the fetus with plenty of oxygenated blood. Supply of oxygenated blood and necessary nutrients to the growing fetus will definitely nullify the chance of growth retardation. In first trimester, increases courage and endurance. In second trimester, soothes and quiets the mind and brain. In third trimester, gives vitality and energy. Discussion. Effective antenatal care should include the practice of yoga and pranayama. It is just a method of changing one's lifestyle, detoxifying and managing stress, all of which are necessary for today's high-risk and valuable pregnancies. Pregnant women can maintain their health by engaging in yoga and pranayama, essential for the fetus health, growth, and development. Pregnancy-related problems are highly preventable. Throughout the pregnancy, the mother's mental state will remain stable, essential for trouble-free typical vaginal birth. The goal of receiving Shreyasi Praja is achieved by traditional lifestyle. Result. Following a study of 15 literature on yoga during pregnancy, 2 case studies indicated that yoga during pregnancy can help with low back discomfort during a typical vaginal delivery. Conclusion. Regular prenatal care can only result in positive outcomes, and every pregnancy is valuable. Pranayama and yoga practice ought to be a part of Dinacharya and Garbhani Paricharya. Good prenatal care should lead to a smooth vaginal birth and the birth of high Abgar kids. Not only can yoga and pranayama support a healthy pregnancy, but they also play a significant role in reducing problems in high risk instances. Thank you so much.
Thank you, Doctor. Thank you for the wonderful presentation. Thank you so much, Doctor. Next, we go to the final presentation. paper and poster presentation. Next, I would like to invite Dr. Radhika Singh for the paper presentation.
Everyone, myself Dr. Ashish Kamble, PG scholar from Department of Ayurveda and Homeopathy Vigyan from Dr. D. Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. So my topic for paper presentation is harnessing artificial intelligence for advancing Ayurvedic pharmaceutical research under the guidance of Dr. Jizaba Shirke, Anagha Chikitsa, Professor, Department of Introduction, Ayurveda Pharmaceutical Branch. It was also research treatment in this department. Science of life or knowledge of life. Origins, it is one of the oldest whole body healing systems developed over 5,000 years ago in India. Pharmaceutical branch. This branch is the most important branch in Ayurveda with over 5,000 permutations and combinations used to treat a wide range of illnesses. Modernization of Ayurvedic pharmaceutics, growing demand. There is increasing global acceptance of Ayurvedic medicine, which necessitates modernization and the use of advanced techniques. Need for innovation. The pharmaceutical branch of Ayurveda requires new approaches to meet growing demand and to remain effective in modern healthcare. Artificial intelligence, AI in Ayurvedic pharmaceutics. AI's role. AI, a rapidly developing field in computer science, can address challenges in drug manufacturing and enhance the production of Ayurvedic medicines. Number one, quick data analysis. Number two, adaptability to preferences and limitations. Number three, capacity to produce clear rules. Number four, faster time to market, reduced costs, and improved quality product. Number five, creation of new goods. Number six, better client feedback. And objective of my study is to study the application and significance of artificial intelligence in pharmaceutics of Ayurveda to overcome the research gap advanced technique between the AI and the pharmaceutical industry. Material and method. Material to identify relevant English-only publications. A search was performed in PubMed, Scopus, International Pharmaceutical Abstracts, and Google Scholar databases using the broad terms artificial intelligence or machine learning with the term clinical trials. Method. There are various tools mentioned in AI which are used in pharmaceutical sciences for research. Some method are mentioned here. Number one, robot pharmacy. UCSF Medical Center uses robotic technology is used for medication preparation and tracking to ensure patient safety. Achievements successfully prepared 350,000 doses, including toxic chemotherapy drugs, without errors. Benefit allows pharmacists and nurses to focus on direct patient care and collaborate more effectively with physicians. Number two, Medi robot purpose. A pain management robot designed to help children during medical treatments. Development led by Tanya Baran. Functionality establishes rapport with children before treatment, explaining procedures in a comforting manner. AI role. 2. The robots cannot think, plan, or reason. It is programmed with AI capabilities to interact with patients in a human-like way. Number 3. Erika robot. Creator. Developed by Hiroshi Ishiguro. Collaboration created in partnership with the Advanced Telecommunications Research Institute International (ATR), Kyoto University, and Japan Science and Technology Agency. Design. Erika features a mix of European and Asian characteristics and speaks Japanese. Significance. Considered the most beautiful and intelligent android, Erika's features were designed based on the average of 30 women's facial features, aiming for a more relatable and aesthetically pleasing appearance. Number 4, Bug. Biotech company, headquarters based in Boston, Berg. AI application uses AI-powered platforms to analyze large patient databases, identify and validate biomarkers that cause diseases, drug discovery. Based on the data, the company selects medicines aiming to eliminate guesswork from the drug development process, reducing costs and accelerating discovery. Result. AI can be beneficial in increasing the efficiency and productivity of various pharmaceutical industries. It can be used in day-to-day life. An attempt has been made to analyze the challenges with probable solutions by using artificial intelligence for global acceptance of Ayurveda. Conclusion. AI in Ayurveda pharmaceutics addresses challenges in large-scale drug availability, ensures quality assurance and standardization, enhances palatability of Ayurvedic drugs, helps in determining proper dosage for formulations, increases shelf life of Ayurvedic drugs, ensures uniform drug supply, improves safety and efficacy of Rasa-Aushadhis. AI's role in pharmaceutical industry. Heavy reliance on research and development for growth and innovation. AI tools like Watson and robotic pharmacy have transformed the profession as a healthcare.
I think it has some technical problems. Once again, I'd like to invite Dr. Rishikesh Kamble for the paper presentation on the topic Harnessing Artificial Intelligence for Advancing Ayurvedic Pharmaceutical Research.
Good evening, everyone. Myself, Dr. Rishikesh Kamble, PG scholar from Department of Rupnita Nivam Vikriti Vigyan from Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. So, my topic for paper presentation is Harnessing Artificial Intelligence for Advancing Ayurvedic Pharmaceutical Research under the guidance of Dr. Jisaba Shirke, MD Kaya Chikitsa, Professor, Department of Rupnita. Introduction. Ayurveda's pharmaceutical branch. It uses over 5,000 combinations for disease treatment, increasing demand. Global acceptance is growing, requiring modernization and advanced techniques in Ayurvedic medicine. Role of artificial intelligence. AI can help address challenges in drug manufacturing. AI can be applied across various Ayurvedic pharmaceutic sectors to improve efficiency and innovation. Ayurveda definition. Ayurveda is a Sanskrit word meaning science of life or knowledge of life. Origins, it is one of the oldest whole body healing systems developed over 5,000 years ago in India. Pharmaceutical branch. This branch is the most important branch in Ayurveda with over 5,000 permutations and combinations used to treat a wide range of illnesses. Modernization of Ayurvedic pharmaceutics, growing demand. There is increasing global acceptance of Ayurvedic medicine, which necessitates modernization and the use of advanced techniques. Need for innovation. The pharmaceutical branch of Ayurveda requires new approaches to meet growing demand and to remain effective in modern healthcare. Artificial intelligence, AI in Ayurvedic pharmaceutics. AI's role. AI, a rapidly developing field in computer science, can address challenges in drug manufacturing and enhance the production of Ayurvedic medicines. Number one, quick data analysis. Number two, adaptability to preferences and limitations. Number three, capacity to produce clear rules. Number four, faster time to market, reduced costs, and improved quality product. Number five, creation of new goods. Number six, better client feedback. And objective of my study is to study the application and significance of artificial intelligence in pharmaceutics of Ayurveda to overcome the research gap advanced technique between the AI and the pharmaceutical industry. Material and method. Material to identify relevant English-only publications. A search was performed in PubMed, Scopus, International Pharmaceutical Abstracts, and Google Scholar databases using the broad terms artificial intelligence or machine learning with the term clinical trials. Method. There are various tools mentioned in AI which are used in pharmaceutical sciences for research. Some methods are mentioned here. Number one, robot pharmacy. UCSF Medical Center uses robotic technology is used for medication preparation and tracking to ensure patient safety. Achievements successfully prepared 350,000 doses, including toxic chemotherapy drugs, without errors. Benefit allows pharmacists and nurses to focus on direct patient care and collaborate more effectively with physicians. Number two, Medi robot purpose. A pain management robot designed to help children during medical treatments. Development led by Tanya Baran. Functionality establishes rapport with children before treatment, explaining procedures in a comforting manner. AI rod. Two, the robots cannot think, plan, or reason. It is programmed with AI capabilities to interact with patients in a human-like way. Number three, Erika robot, creator, developed by Hiroshi Ishiguro. Collaboration created in partnership with the Advanced Telecommunications Research Institute International (ATR), Kyoto University, and Japan Science and Technology Agency. Design. Erika features a mix of European and Asian characteristics and speaks Japanese. Significance. Considered the most beautiful and intelligent android, Erika's features were designed based on the average of 30 women's facial features, aiming for a more relatable and aesthetically pleasing appearance. Number four, Bug, biotech company, headquarters based in Boston. Bug AI application uses AI-powered platforms to analyze large patient databases, identify and validate biomarkers that cause diseases, drug discovery. Based on the data, the company selects medicines aiming to eliminate guesswork from the drug development process, reducing costs and accelerating discovery. Result. AI can be beneficial in increasing the efficiency and productivity of various pharmaceutical industries. It can be used in day-to-day life. An attempt has been made to analyze the challenges with probable solutions by using artificial intelligence for global acceptance of Ayurveda. Conclusion. AI in Ayurveda pharmaceutics addresses challenges in large-scale drug availability, ensures quality assurance and standardization, enhances palatability of Ayurvedic drugs, helps in determining proper dosage for formulations, increases shelf life of Ayurvedic drugs, ensures uniform drug supply, improves safety and efficacy of research. AI's role in pharmaceutical industry, heavy reliance on research and development for growth and innovation. AI tools like Watson and robotic pharmacy have transformed the profession. As healthcare becomes more advanced, the pharmaceutical industry requires technologically advanced infrastructure. AI helps in algorithm design and data analysis to meet the industry's needs. Discussion. The identified opportunities and challenges as well as the future consequences for integration, manufacturing execution system, automated control process system, ACPS, tug robots are another method which are used in the pharmaceutical industry, which are beneficial to the growth of pharmaceutical branch. Thank you.
Thank you, Dr. Rishikesh Kamble, for the relevant topic of paper presentation. Next, we go to the poster presentation on the topic role of Panchakarma in the management of Pakshaghat.
for रोगनिदान एवं विकृति विज्ञान from Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. So today's topic for my poster presentation is role of Panchakarma in the management of Pakshaghat. So the introduction of Pakshaghat is that Pakshaghat, the challenging neurological condition known as hemiplegia or stroke, where the role of Panchakarma emerges as a vital component in its management. The term Pakshaghat literally means paralysis of one half of the body, where Paksha denotes either half of the body and Akar denotes the impairment of Karmendriyas, Gyanendriyas and Mana. Acharya Charaka included in the Nadatma Svedi and Madhyam Roga Marga. So the shlok explained by Acharya Sushruta is that Tatra Prageva Snehabhyuktam Svinna Shariram Avapidanena Tikshnen Upakramet Shirashuddhartham. That is Snehan, which is internal and external ovulation. Similarly, Shushkan Nabi Kashtani Sneha Svedopapadane Namayanti Yatha Nyayam Kim Punarjivatu Naran. Then Svedana, that is body heating. Then Tikshna or Pidanasya, that is transnasal administration of medicaments. Second part of the treatment is Mrudu Shodhan, that is mild detoxifying procedures. Shlok explained by Acharya Sushruta is that Mudana Shodhanena Samshuddha Anuvasya Sapyacha. Anuvasan, that is enema with bala oil. Bala Tailam Anuvasanarthe. Then Astapana, that is enema with medicated decoction. Pamana is given on the 9th day. Virechana on the 24th day. And Basti from 32nd to 62nd day. Third part of the treatment is Shirobhasti, that is retention of oil over the skull. Shlok explained by the Acharya Sushruta is that Vaishishika Chartha Mastishka Shirobhasti Anu Trailam Abhyangarthe, that is Abhyanga massage with Anu oil. Then Salvanam Upanaharte, that is Salvan Upanaha, application of Salvana poultice. Then the treatment of Pakshaghat is Spedram Sneha Sayuktam Pakshagate Vireshanam, in which pranvayu is affected. Direction of pranvayu gets opposite, that is upwards. To make the direction of pranvayu downwards, that is Anulomana. Therefore, Sneha Vireshan is given in Pakshaghat. It affects Sira and Kandara, that is Upadhatus of Rakta Dhatu. Rakta and Pitta are interrelated with each other. To eliminate Dushti of Sira and Kandara, therefore Sneha Virechana is given in Pakshaghat.
Thank you, Dr. Rishikesh Kamble, for the well explained paper and poster presentation. Thank you, Doctor. We have come up to the official end of Pranava National Seminar presentation. It fills me with immense pride and gratitude to witness the success of this event. Over the past days, we have delved into the profound depth of Ayurveda, exploring its timeless wisdom and modern application through engaging presentations and discussions. This seminar has truly been a platform for learning, sharing, and inspiring new ideas in the field of Ayurveda. I would like to extend my heartfelt thanks to the panel members who have worked tirelessly day and night to ensure the smooth execution of this event. Their dedication, vision, and meticulous planning have been the backbone of this seminar's success. Without their hard work, this event would not have been possible. A special note of gratitude goes to the esteemed professors and enthusiastic students from various colleges who contributed significantly to the success of this seminar. Your active participation, insightful questions, and truthful contributions have added tremendous value to this platform. You have made this seminar not just an event, but a vibrant exchange of knowledge and ideas. Finally, I would like to thank all the presenters who shared their expertise with us. From exploring Ayurvedic management of diseases like Amavata and Shitra to understanding innovative approaches like the therapeutic role of music and the significance of Trayobastamba in infertility, each presentation enriched our understanding of Ayurveda's vast potential. The diversity of topics such as the Ayurvedic perspective on grithrasi, neonatal cholestasis, and the purification methods of Guggulu showcase the depth of research and practice in the field. As we conclude, let us carry forward the insights we have gained and the connections we have built. Let this be a stepping stone for further advancement in Ayurveda and its integration into modern healthcare. Together, we can ensure that the science of life continues to benefit humanity as it has for centuries. Thank you all once again for being part of the Pranava National Seminar presentation and making it a grand success. Wishing you all the best in your future endeavors in the field of Ayurveda.